तू कर इधर आ जा फिर देख। ये जो मेन जो
अरे
फोटो था
कनुष
ना,
को बुलाओ। कनुष कनुष को हमने इसी के लिए बुलाया था। कहाँ है वो?
ये जो मेन जो फोटो जो पीछे लगने वाला है ना,
हाँ हाँ हाँ,
ये वो
लगा
वाला
के
फोटो
रखना
है।
है। ठीक है,
लगा के रखो अभी से।
हाँ लगा दो। ये क्यों दिखाएंगे? लगा दो।
हाँ ये एक सेकंड मैं दिखा दे रहा हूँ। ये तुम्हारा, ये एक और किसी का है, शक्ति का शायद ये
शक्ति
न्यूरो
का ही मेरा।
एनहांसमेंट का।
हाँ हाँ वही, ये नहीं लगाना। स्पीकर नोट्स में फ़ोन में खोलने के लिए बनाया था भाई मैंने।
वो बोला मुझे कि सब इसमें
ठीक है
ट्रांसफ़र
ठीक
कर
है,
दे।
कोई बात नहीं।
फिर ये मृदु का, फिर एक अखिलेश का है, ये अखिलेश का, मंजुनाथ सर का, और एक हेमाकृति करके कोई
अब उसका नहीं पूछा।
मुझे ऋषभ ने इतने भेजा है।
ठीक है।
हाँ?
और ये कनुष को एक बार पूछो, कहाँ है कनुष?
लग
ये
गया।
कैसे लगेगा? नीचे तक आए जाना चाहिए। Where is Muskan? Can anybody see? Muskan. What the fuck? कौन है?
I cannot see that. मैंने सुबह से नहीं देखा उसको।
कनुष को भी कहो।
मुस्कान का मेरे पास नंबर नहीं है।
ब्रो, ये शक्ति को भेजो।
हेलो हेलो हेलो
output of from the brain to the external world. The brain, but now it is the output from the brain to the external world, how it can be utilized for the future purpose. It may be a good purpose or a bad purpose, we don't know, but as of now, what all the things which you are supposed to know. So why this topic? This topic is mainly because it is a futuristic market. Okay, plenty of money is involved. As a medical professionals, we may not be so much thinking of innovation, but engineer graduates are sitting idle very much, so their growth is dependent on innovation. So they keep trying, and one day definitely they are going to come out with all these activities. So you have to be prepared for this. Just to So this is what is expected of the future, and there are plenty of areas where we are still we are using, but as a medical this thing application, we don't know how far it is effective, but not many studies are there. So my scheme of presentation and the learning objectives, I will be talking about what is this BCI, how it works, what are the types of BCI, what are its application, and what are the challenges of this BCI. This is what it all tells about. You think it and it happens. There is nothing to do. There is nothing to do, you just think it happens. Okay, so for example, now can I prepare PPT just by sitting and thinking, I want to have this slide, I want to have this image. Is it possible? Future, it is possible. Okay, as of now, it may not be possible. Future, it is definitely possible. This is the disclaimer. I have no research, I have not done any research on the BCI. I don't have anything. It is all literature-based information, what I am going to give. Okay, so don't ask too many questions about what is my work in this. I have not done any work here. Okay, so that is very much clear. So what is this BCI? It is an advanced communication system that leverage brain activity, which sends signals as a medium, converting them into desired outputs to enable users to operate external device. Okay, so there is some signals which goes to the device. From there it goes to the machine's external device where it is going to produce the response. How it works? So you can see here, just a thought. Just a thought is sufficient. It goes to the computer. Now inside the computer, there are plenty of processes which takes place. Okay, there are plenty of things which takes place. I'll explain about that. Okay, so whatever the things, right from acquisition, pre-process, everything occurs here. And now finally it creates a signal which sends as an application, and it goes back to the brain as a feedback. Okay, so all these days it was an input which goes to the brain. Now there is an output. Okay, it is not just an output. Now just having an output is not good, so it should be a closed loop. Okay, unless it is a closed loop, it may not be beneficial. So output has become again a feedback. So then it is a closed loop, which is the reason why we are using it as a clinical application. Okay, this is a computer language, that is machine learning. Okay, so what happens in this machine learning process? Okay, so first one is, there are plenty of devices which will be placed in the brain. Okay, so from the devices, the signals are acquired, and I'll show you what all the instruments which are used here. Okay, signal is acquired through the device. From the device, it goes for pre-processing. So plenty of sound is there. The original raw signals are very noisy. Multiple thoughts are coming. It is not just one single information what is being sent. So multiple signals, it is very difficult to catch up. So you have to do what is called as a pre-processing, where you are going to remove all the noisy data. It's also called as debugging. Okay, so they do debugging, filters, all the artifacts will be removed. So this is called as pre-processing. So once the pre-processing is over, they send for feature extraction. So what is this feature extraction? They categorize based on the frequency bands and spatial patterns. Frequency bands, alpha, beta, theta, delta, there are 3 different bands which are available. So according to that, they are going to classify there. Okay, so frequency bands, extraction will be there, or spatial patterns, and this feature extraction will in the next step, it goes for classification. So what is the classification? Whether the patient has got right-handed problem, left-handed problem. So what is the problem, where it has to be applied? So it gives a clear classification. So once the classification is completed, it goes for what is called as a program output. Now it has prepared input, which is multiple signals has entered. Okay, now it has narrowed it down, clarified it. This is also called as, we call it as artificial intelligence. So the machine learning does all this process. The program out. So the program output is there, and you are going to give a real-time feedback, and the patient who is using or a person who is using can go for adaptation. Okay, so this is what happens in the computer when the output goes to the computer. Okay, so that's why it's called as brain-computer interface. Now coming to what are the types of brain-computer interface. So there are basically 2 types. One is invasive, another one is non-invasive. Semi-invasive is there, not much use. Okay, so one is invasive, another one is non-invasive. In the invasive, we also called as electrocorticography, where it is the invasive is the electrodes are placed deep inside, and they are going to take the signals or collect the signals. Whereas in non-invasive, we have got plenty of devices which they use to generate the signals. What are those? It may be EEG, very commonly used. Next is functional near-infrared spectroscopy, functional magnetic resonance imaging, and magnetoencephalography. In this case, there is no invasion here. It is the superficial electrodes. Okay, but closer the electrodes into the brain, better is the signal. If you are placed externally and if you are generating signal, okay, it may not give the much information. That's why they always tell that closer the brain, the neural network, you are going to be able to identify much better signals. Okay, so, but what is the problem now? Invasive, there is always a risk of having the electrodes inside for a longer period. So there is always a disadvantage, but you have to see what is the risk and benefit. The other method of classifying this BCA is, we have called something called as passive, something called as active, another is called as reactive BCA. So what is this passive? Passive use, now I can just give one device for all of you, and I can collect the information what you are thinking about this presentation. That is passive. You are not doing anything. It is just passive. Whereas an active, you can modulate. Okay, so you just start thinking, move your hand means it starts moving. You're thinking to move the hand, it starts moving. That is called as active. And reactive, this is of course utilized in the flights, where they are going to take the signals, what they visualize, they take a feedback, and accordingly they react. That is called as reactive BCA. Okay, so there is one is called as invasive, non-invasive. Other one is called as active, passive, and reactive BCA. Now coming to application, where all we can use it for the patient. One of the most, because we are more interested to have this device for the patient. So one is restoring movements, mobility and autonomy, especially for paralyzed patient, especially spinal dissection or people who have suffered with severe injuries. Okay, so where they are not able to move, for them, it can be used, and you can improve the quality. Thing is, it helps in assisted communication. So what is assisted communication? Okay, so there is a mediator between the patient and the doctor. There is a computer. The doctor asks the patient, patient will tell to the computer, computer will tell the answer to the doctor. So that is what is called as assisted communication, because the patient is not able to communicate. I'll show one video of that. Okay, next is seizure prediction by EEG. Because you are collecting the signals by EEG, you can also predict whether the patient is going for any convulsions during this procedure. Optimizing deep brain stimulation in Parkinson's disease. Based on the feedback for the closed loop system, you can identify whether the patient is improving or not improving. So you can optimize the deep brain stimulation based on this. Next thing is, these are some of the things which is possible, and they have made it possible also in some areas. Okay, so we can have artificial retina and visual cortex. People who are blind can start visualizing what they think, and it goes and back into the brain, and so the image is created. Okay, so there is something called as artificial retina and visual cortex. And similarly, auditory. People who are suffering from auditory disability can also have some auditory processes in the future based on this. There is something called as neurofeedback theory, which the neuropsychiatric, most of the neuropsychiatric condition, they will be using it. So what is this neurofeedback therapy? So these are the conditions we use for adults, plenty of conditions which can be used, and even for the pediatric age group it can be used. This is called as neurofeedback theory, where it gives a feedback, and according to feedback, they just get adapted and modified. This is called as neurofeedback theory. This is for the patients. Okay, so not many literature is available. Indian literature is available. Most of the literature is available is of the China or some other country, and it is not that much convincing evidence. So it is, nobody has given a convincing evidence that it will be a future. So there is always a question mark which they have always raised. What is the advantage for the doctors? What are the clinical applications for the doctors? Okay, so there is something called as, I told you, computer augmented communication. I want to talk to the patient, but patient is not responding. So how is it possible? So I'll just show you what is that.
Bothering you? There's still tightness in your chest. It's expected. Is it your eye? I'm not saying no. Maybe he's saying down. Are you saying that the pain is lower? How low? Your leg? Your foot? Left foot? Bunch of kids. Let me see now. Yeah, it's right foot. No bruises, no rashes, no cuts. There should be no pain. Tingling sensation? Yeah. An itching.
Okay, so what is that you observed here? A patient who is in comatose condition, okay, he may not respond, but still what he can respond through the signals, he has conveyed the message, yes, no. Okay, so that is how the computer assisted augmented communication can be enhanced. What are the future trends for the doctors? Can it be utilized for the doctors? Yes, definitely. Suppose if the doctors goes for disablement, okay, he is not able to auscultate or he is not able to explain, prescribe, but still he can start thinking about it, and that can go to computer and it can generate it. I'm telling about the future trends. Okay, this is what I thought. This is fiction for me now. Okay, so it is a fiction for me. Okay, so, and even for prescription, I sit there, I think I want to give some prescription drugs. Okay, so I just keep thinking, and automatically the drugs list has to come. This is the future. Okay, I don't know whether it is fiction or it's going to be a future. Okay, so if the BCI becomes a prominent device, then we will definitely will have it. Okay, so this is as far as the application for the doctors are concerned. For the students, okay, so there are certain things which cannot be read of the students. Attentiveness, whether the student is attentive or not, whether their enthusiasm is there or not, whether they are engaged in the activity or not, fatigue, motivation. It's very difficult to identify what is the level. So this can be used as a personalized method where you can identify what is your status, and accordingly you can adapt to the newer methods. Okay, so this is how it can help the students. How does it help the teacher now? BCI can also help the teachers. How is it possible? through the neurofeedback, you can assess the students, give a feedback, and the cognitive improvement can be done. So it is not just only for the patients, it has got multiple application. Okay, it's not just patient, doctor, even for the students, even for the teachers, it is useful. What about the general public? Okay, now we have got, what is that? Siri. Siri is there. But for Siri, you have to talk. For BCI, there is no need to talk, you just think. That is advancement of the technology. Okay, so for Siri, you have to tell that open or okay Google, call him, all those things are there. You have to talk. But in this case, there is no need to talk. It is just you think and it will open. Lights off. I have to think, lights will go off. See, now I told lights man, not mic. Okay. Okay, I think, so there is a confusion. It has to go to computer only will send signal to the switcher. I'll discuss afterwards, sir. Okay, so as far the public, general public is concerned, so what is its role now? So now we are utilizing Siri, Google Map, so many things are there. So henceforth it may not, the future will be like this. See, this is how technology has progressed. Switching on, off light. Lying on the bed, just think I want to sleep, just sleep and switch should go off. Otherwise, now you have got a remote. So that remote will go for in the future, there won't be any remote. TV, power, regulating temperature, all those things. Next thing is, it's about the gaming and entertainment. It's about the gaming and entertainment where they are used maximum about this BCI. Next is skills training in flight simulation or military training where they use this BCI. Neuromarketing by tracking the minds. So you can select few people and identify what is their trends, what they are thinking about the product. So based on that, you can identify whether the product can be launched or not. So for marketing purpose also it can be used. And you can create music, think. Like Dr. Swami, you can just think and you can create the lyrics. Or somebody who is a musician, okay, you want to do something, you can create it. Okay, so creating music and visual art is possible. Okay, so all this can be used, applied by the public. Right time the employers also has come. Okay, so for the employer, what is the advantage, what is the application at the employer level? At the employer level, they always look into attention level and mental state of employees. Okay, so this can also be done. Okay, so if you send all the employees for this test, what is this, they say mental level, attention level of those, you can identify. You can give a feedback to improvise where they are lacking, all those things. So that is also possible with BCI. This is for the employer application. Okay, so you got application not only for the doctors, not only for the patient, it is helpful for the public, it is helpful for the student, it will be helpful for the teachers, it is helpful for the employer. But it always comes with some riders, so there are challenges. So what are the challenges? When you are using BCI, there are plenty of drugs the patient will be taking. Those drugs can release certain chemicals or acting on the receptors through chemicals. Okay, so they can interfere with the output of your signals. Number one. Number two, regulatory approval. Approval of this device, it does not come under or fit into a medical device for the clinical trial regulatory authorities. So it is not a medical device as of now. So either it is a medical device, not a medical device, still under confusion. So unless it is diagnosed or when it is labeled as medical device, it can be done. Okay. Third one is cost and reimbursement. Okay, so prioritize the needs. Who actually requires it has to be provided. Okay, so prioritizing the needs of this BCI is very important. People who can afford should not go. It should be available for everybody. Okay, and there is always again, I always thought about this. There are people, multiple personality disorder, they'll be thinking multiple. So how is the computer going to catch all the signals of it? So again, that is a challenge for the computer, not for us. It is a challenge for the computer, how to channelize or how to characterize it. What are the risks? There are certain risks. What is it? Privacy invasion. Access to all his thoughts and emotions. What I'm thinking, computer is knowing. Whoever is operating computer knows what I'm thinking. So your privacy is invaded. Do you want it? Loss of autonomy. It is externally controlled. People starts controlling your brain. People starts controlling your activity. So it is externally controlled. Next is emotional attachment. The more you start using it, because you are not doing anything, sitting, and everything is done automatically, you are having a chance of more addiction or detachment from the surrounding. Okay, just like your mobile device. Misused by many due to lack of legal laws. There is, because I told you it is not a device, okay, it can be misused by plenty for different purpose, even for illegal activities it can be done. Okay, constant surveillance by employers can also be adopted. Okay, so these are some of the risks which the people or the patients can undergo. The trends, what are the trends as of now? Okay, so this is the first person to have just sitting and he starts thinking, the mouse starts moving and the computer is operated. That was the first thing, that was the Neuralink company which done this implant. And the second one was the games, mobile game. Alex, he used to play, was first person shooter game, Counter-Strike. Okay, so such type of things, medical personnel will not keep doing innovation. So we have to be very careful of our counterparts, engineers. So because they are always supposed to innovate, and they innovate, we are going to end up with these things. This is the cerebral motor disability sports person. Okay, with just this technique, she was able to hold the torch and she was able to be the torch bearer of that sports thing. What all the places meta-analysis tells about the future trends are present? There are plenty of, for the diagnostic purpose, seizure and brain malignancies, epilepsies, disorder of consciousness, brain tumor, dementia, sleep apnea, all these things can be diagnosed with the help of BCI. And for rehabilitation, especially for the stroke patient, and as an assisted device for neuroprosthesis, assisted device for the environmental control, assisted device for the communication. So it has got multiple roles, okay, which have been identified. We have to wait and watch where it is going to be established. Finally, the SWOT analysis of this brain-computer interface. What you're supposed to understand is, there are devices, how much to use, what not to use. So you have to identify the strength, weakness, opportunities, and threats. So what are the strengths? Direct communication with the brain. So you can communicate with the brain and you're extracting the information. Next is plenty of medical application, especially the paralyzed people. Next thing is technological innovation. It is an innovation. Okay, so how far it is going to be adaptable, we have to find. Next is, it is an expanding market because people are day and night working on it. So we might start getting all these devices. What are the weakness? Cost and complexity of the device. Next thing is invasive, infection, all those things has to be thought of. Data accuracy and noise. Whatever the data, what it is going to generate to the computer, how accurate is the data, what is being provided, and the information. Limited scalability. So what we are going to generate, it cannot be generalized. It is always individual. You cannot scale to the multiple levels. It is only for the particular individual. Next, coming to what are the opportunities. Opportunities is definitely for the neurorehabilitation. It is beneficial. Gaming, especially the virtual reality games. Cognitive enhancement for the students or any other person who are in the academic activity. Market analysis. Okay, so any person who want to market anything or promote anything, he can do some analysis utilizing people of different thing who are the end users. Based on that, you can do the market analysis. Now coming to the threat, what are the threats of this BCI? Ethical and privacy concern. Ethical issues, plenty of the things are there. Dr. Rasimurthy will be talking about it. Privacy concern, somebody is invading your brain. You imagine somebody who is controlling your brain. Nobody likes that. So it has to be you have to be very careful about it. Regulatory hurdles, it is not a medical device. So till it gets branded as medical device, there will not be much law. User acceptance, how many people are going to accept it, that is again. And most important is hacking. All information, whatever is there in the computer, anybody can hack your information. That is also one of the threat. Okay, so these are the strengths, weakness, opportunities, and threats of a BCI And to end my talk, the development of full artificial intelligence could spell the end of human race. This is what Stephen Hawking has told. Okay, so we can't depend on the artificial intelligence. If everything becomes artificial intelligence, human race will be erased. Okay, so with this, I conclude my talk about the introduction to basic computer interface. Sir. Consciousness is part of the brain only. I think you asked this question long back also.
Yeah.
Same question.
So even the scientists have not solved it. So if the thoughts are not happening inside the brain,
Your
how
question, I think your question I cannot answer.
Okay.
Because one thing is wherever I learned, I will find out and I'll answer to you, so what it is. Okay, so as of now, I told you, I gave a disclaimer. I had not done any research on this, or I have not created any device also. It is purely on the literature.
That's why only advanced yogic masters can send thoughts and get the reply. So scientists are not able to do such a thing because the thoughts are happening in the consciousness. It is not happening in the brain.
Okay.
Only with advanced yogic techniques you can do this kind of feat.
Okay, sir. Thank you. Sorry to interrupt. We will just have an inauguration function because sir has to leave for some other function. So later we will continue, sir. We all will discuss. Okay. I think towards the end of the day, we will have some clarity regarding this. It's kind of a confusion, sir. That's why we have taken up this subject, brain-computer interface. This reminds me of ni maayayo ninnola maayayo. So we'll keep thinking and juggling with the thoughts. So let's start our inauguration.
फुल स्क्रीन है.
Good morning, everyone. I'm Tanaz Jamkhandi. A very warm welcome to all the dignitaries present here. It gives me immense pleasure to welcome you all to this enriching CME session on brain-computer interface and pharmacological implications. The concept of brain-computer interfaces, or BCIs, once a realm of science fiction, is now rapidly becoming a reality, transforming how we understand brain function, how we deliver drugs, and how we envision therapies tailored to the individual. Before we dive into this fascinating field, let me take this opportunity to acknowledge and thank the organizing committee, our respected faculty members, and our distinguished speakers who will guide us through today's session. Moving towards the inauguration ceremony, I respect all the dignitaries to please be on the stage.
So we are doing this CME in coordination with our Karnataka Society of Medical Pharmacologists. I would like to call our KSMP President, Dr. Manjuna sir, on stage.
To begin with, in Sir's absentia, I welcome first Dr. G. Parmeshwara sir, Honorable Chancellor and Home Minister of Government of Karnataka, the driving force of our institution. I now welcome Dr. Lingegowda KB sir, Vice Chancellor SAHE. Your administrative guidance has been instrumental in making this event possible, sir. Thank you, sir. I would now like to welcome Dr. Mallikarjun B. Sanikop sir, Principal SSMC, a pillar of support in all our academic activities. We welcome you, sir. I would now like to welcome Dr. N.S. Venkatesh sir, Medical Superintendent SSMC. We welcome you, sir. I now welcome Dr. Ashok Mehta, sir, Registrar Sahe. We welcome you, sir. I would also like to welcome Dr. Nandini T. Ma'am, Professor and HOD, Department of Pharmacology. We welcome you, ma'am. I would like to also welcome Dr. Manjunath G. N. Sir, KSMP President, Professor of Pharmacology. We welcome you, sir. I request all the dignitaries to move towards to light the lamp. I would like to extend my warm welcome to Dr. Rajeshwari Devi, ma'am, Medical Superintendent, SSMC. We welcome you, ma'am. I now invite Saujanya for invocation song.
ಶರಣು ಶರಣು ಗಣಪತಿ ಶರಣು ಮಹಾಗಣಪತಿ ಶರಣು ಶರಣು ಗಣಪತಿ ಶರಣು ಮಹಾಗಣಪತಿ ಮಹಾಕಾರ್ಯ ಮಹಾವೀರ್ಯ ಮಹಾಮಹಿಮ ಗಣಪತಿ ಮಹಾಕಾರ್ಯ ಮಹಾವೀರ್ಯ ಮಹಾಮಹಿಮ ಗಣಪತಿ ಮಹಾತೇಜ ಮಹಾದೇವನಂದನ ಶ್ರೀ ಗಣಪತಿ ಮಹಾತೇಜ ಮಹಾದೇವನಂದನ ಶ್ರೀ ಗಣಪತಿ एकदन्तनेकचरित श्रीकरा गणपति एकदन्तनेकचरित श्रीकरा गणपति पाकशास्त्रनादिवन्द्यशोकदूर गणपति पाकशास्त्रनादिवन्द्यशोकदूर गणपति शरणु शरणु गणपति शरणु महागणपति शरणु महागणपति.
Once again, a heartfelt welcome and thank you to all the dignitaries for your gracious presence. Your encouragement and participation make this academic platform truly meaningful. Thank you, everyone. I request Vice Chancellor, sir, Dr. Linge Gowda, sir, to enlighten us with a few words.
So you have only instructed me to speak few words. So I have somewhat limited time. Good morning, everybody. Hearty congratulations to the team of pharmacology. When you guys entered my chamber, I thought you have come with some demand. all 5 of you with students. I'm happy that at least this kind of academic events are happening regularly in your department under the leadership of Professor Nandini. I still remember myself, Dr. Manjunath Sonakap, when we joined, few of our students had gone to other colleges for presenting papers. And there are opportunities for you people to go outside the country and present your paper and publications. Only thing is you people have to come forward. From our engineering college, just last week, 5 of our students, at least your medical students, without any support they had applied. Our Honorable Chancellor, Dr. Parameshwara sir, was magnanimous to sponsor all 5 of them and also one teacher to travel all the way from Bangalore to Chicago to attend the meeting and have 1 week trip and come back. Similarly, even here in medical college, you'll be happy. Only thing is you have to come forward. The problem with our present generation is, why me? Unless you get involved in publications, nobody will recognize. Believe me. The problem here is you think that because you're not looking for another person who has presented, and you got excellent teachers like Manjunath or Narsimurthy or others in the department. Our only wish we are from university, we are always there to support you. And even management is always there to support you. And your principal with almost 3 decades of administrative experience is eager. Just now while we were just discussing something else, such kind of negativity will not take you anywhere. No, before you complete your this particular year or in the next year, take the help of your teachers, prepare some papers, attend national conferences, aim at attending international meetings anywhere. From academy also, we are there to help you people. Only thing is you have to come forward. And this is one of the best university across the country. With, see, out of 1,000 and odd universities, very few, like only 35 to 40 are with NAC A+ grade. So you are one among them. You should feel proud that you are studying in such kind of universities. Just a few weeks back when we had the cardiac fronted meeting, one of our old student had come from Bangalore. He was feeling so happy, sir, so much changes has taken place. I don't see this kind of atmosphere. I don't see this kind of opportunities anywhere else, even in Bangalore, even in the best of the best college in Bangalore. See, that kind of facilities management is providing. So ultimately it is you people, we have to make use of facilities. I wish you all the best, and I have to go for another meeting in our another engineering college for the graduation day. I thank all the departmental people. I congratulate Dr. Nandini and her team, and you got excellent team. And Nandini madam, you should continue doing this kind of meetings quite often. That will take you, and even Manjunath with his 2-3 decades of experience in academics and administration, both of you should work like a team. Then only you will be able to take it forward. I wish you all the best. Congratulations. Jai Siddhartha. Thank you.
We now proceed towards announcing distinction holders of pharmacology of previous year. I request Dr. Linge Gowda sir to hand over the certificate and the memento to the topper, Hemakruti R, who has secured first place distinction with 81.33%. Sanjana N. Murthy, who has secured distinction with 80.33%. Astha Oja, who has secured the distinction with 76.66%. Diksha B. Praveen, who has secured distinction with 76.66%. Kavita Kumari Singh, who has secured distinction with 76%. Medini S, who has secured distinction with 75.66%. Srinidhi Sagar, who has secured distinction with 75.66%. Suvenya S, who has secured distinction with 75.33%. Thank you, sir. It is my great honor to extend heartfelt thanks to our esteemed dignitaries present here today. Your presence has not only graced this occasion, but also added immense value and significance to it. We are truly grateful for the time you've taken from your busy schedules to join us. Your support, guidance, and encouragement mean a great deal to us. Thank you, everyone. Moving forward with the academic session, up next we have Dr. Pradeep Kumar, sir. Dr. B.T. Pradeep Kumar sir is a professor at Siddhaganga Medical College and Research Institute, Tumkur, with 10 plus years of teaching experience. He completed his MBBS from K.S. Hegde Medical College and holds an MD in Pharmacology from Bangalore Medical College and Research Institute. Dr. Pradeep joined his current institution on 28 Feb 2023 and is actively involved in academic and clinical teaching since then. We welcome you, sir, with a round of applause.
Very good morning to one and all present here. And thank you so much for that nice introduction about me. So before I start my presentation, I just want to quote the same disclaimer given by the Manjunath sir, that I'm not involved in any of the project which is there in the presentation. I just tried to gather some information which is available in the internet and try to share with you, that's all. Okay, so to begin with, my topics is the brain-computer interface assisted drug delivery systems. So as sir said, the information is so limited and the research is so limited, in that I have to search about the devices. Okay, So I tried my best to gather the information. So to begin the introduction, what is the brain-computer interface assisted drug delivery system is an emerging field, interdisciplinary field combining the neuroscience, the biomedical engineering, pharmacology, and nanotechnology. So what is the goal? The goal is to control or to modulate the devices into the brain or other parts of the body by using the real-time brain signals. So why do we need this? Why do we need the brain-computer interface assisted drug delivery system? Or what are the limitations? Since students are here, what are the limitations of the traditional drug delivery system? What are the limitations? I'm sure you must have completed the general pharmacology, source of drugs, and special drug delivery. What are the limitations of those devices? Anybody? Many distinction holders are there here. Oh, they left, fine. So what are the limitations? So off target, because whenever we use the devices, the systemic administration is more, that can lead to lot of adverse drug reactions. And most of the drugs, they have to cross the blood-brain barrier and the blood CSF barrier to deliver the drug. That is not happening because of the barrier system which is there in our body. And we need high dosage of the drugs to cross these barriers, which ultimately leads to drug toxicity. And the poor viability of this traditional drug delivery system, we are moving forward towards the brain-computer interface assisted drug delivery system. So pardon me because I have to say this, because everybody without this, what is BCI, we cannot move forward with the presentation. It is a system that enables the direct communication between the brain and the external or the internal device. So typically using the electrical signals or the brain imaging in the form of EEG, ECOG, that is electrocardiography, or stereo electroencephalography. All the signal has to be captured by the devices, and this information is translated into commands. So that control the internal or the external devices. Here we're talking about the drug delivery systems. So the idea is to detect the specific brain signals in related to certain diseases, like to detect the abnormal electrical activity before the onset of seizures, the abnormal oscillations or the spike patterns, or the drug deficiency or the hormone deficiency level in the brain. So that has to be detected, and that signal has to be communicated with the delivery system using a smart delivery system or the devices. So what are the key components of this brain-computer interface drug delivery system? So the basic is we need a brain signal acquisition in the form of EEG, FRMI, the functional magnetic resonance imaging, or the sensors. These are done or captured by the intracranial electrodes. And that electrodes will also have the signal processing units which transmits or converts the brain signal into the commands. So then we need communication interface, that is the wireless module, to transmit the brain data into and the drug delivery system. And the feedback, once the drug is released by the devices, so based upon the response obtained, the feedback is given to the BCA system again. So which monitors and adjusts the dose and the frequency of the dosing intermittently or automatically. So this is what the brain acquisition. Okay, so here we capture the electrical activity of the brain with the help of the invasive or non-invasive methods. Then they undergo the signal processing. The signal will be translated or transmitted to the devices, and the devices will release the drugs on demand. And based on the response obtained, that the feedback is given back to the system so that it adjusts the dose or the frequency of dosing can be adjusted. Now how it works, simple. So we have to implant the electrodes, so that capture the brain signal or the activities. So they analyze the EEG, what is the descent pattern, what is the problem is happening, that has been detected. So that information will be delivered to the drug pump or the drug delivery devices. So that releases the drug. So that will produce the impact on the brain, or it produces the effect. Then the feedback is given. So the brain CI, brain control interface, that monitor or the adjust at the dose automatically. So this is how the brain control interface, the drug delivery system operates. So what are the devices available? So these are all at the level of animal studies, and some of them are still in concept. So the first one is the optogenetic channels. So we have got 3D flexible microfluidic drug pumps, the microelectrode neural probe with integrated drug delivery system, implantable microchips, and hydrogels. So we'll see one by one. What are these optogenetic channels? In simple, they are the light activated drug delivery system. Okay, so it is made up of a silicon polymer, okay, thickness about 50 micrometer and the width about the 500 micrometer. It is made up of a silicon, that is polymethyl dimethyl isoxylane. That is the polymer it is made up of. It is very flexible. So whenever the light is emitted with the help of the light emission diodes, the drug will be released. Simple. So that is the one. So basically, what is the cut section of this image shows here? It has got the micro LEDs, then microfluidic channels. Then we have got the drug reservoirs here. Above that, there is a copper membranes to prevent the evaporation of the drug, which is there in the reservoir. Then we got expandable layer, and we got heaters. So how this device works? So whenever the abnormal activities are happening in the brain, that is be taken by the electrodes, that is the BCI, that detects a signal. So it triggers the micro LEDs. So the micro LEDs, that light activates the pump or the microfluidic pump here. So the drug is released into the target site. That is how the pump works. Okay. So I got some how this device works. So this is the optogenetic device which delivers the drugs on the photostimulation. So you can see here the drug will be released here slowly. The light stimulated, the drug is released here. Okay, so this device, it shows the capacity of the device to deliver the multiple drugs. Okay, if anybody needs multiple drugs has to be given to that particular patient, this device has the capacity to deliver the multiple drugs through independent channels. So this is the one, the red light. So that the liquid is here, it shows the liquid. This is the red liquid which is coming through the one independent pathway. So channel to yellow, it is not that much visible. So this will release the another drug through a independent pathway or the channel. Yeah, this is the blue one. So another the drug or the another fluid will be released through another channel. The three drugs or the fluid has been released in response to light, and the fourth one, the green. So this is how the multiple drugs can be delivered with the help of this optogenetic channels. So this one shows the implanted device in the animals. Just shows that it will not affect their behavioral activities. So for that purpose, this video has been posted here. So this is how it has been implanted in the animals. Okay, then next one is 3D flexible microfluidic drum pumps. You can see that it has been compared with the dollar. Okay, it is just 5 millimeter in diameter. It consists of a reservoir and the microfluidic intercable. This is flexible penetrable micro electrode array. This is the connector, and this is the flexible penetrating circuit board. Okay, this is the drug delivery pump. How does it work? Okay, this is the cross section of the devices. Again, this is the channel for the release of the drug. This contains the reservoir, and this is the electrodes. Okay, this is the drug delivery system and how it is being implanted in the animal studies. Okay, we got one more microelectrode neural probe with the integrated drug delivery. So this is the catheter, drug delivery catheter, which is consists of some 16 iridium electrodes. These electrodes capture the brain signal and helps in the delivery of the drugs. This is how it acts. Okay, electrodes will be implanted. So that detects the brain activity, and the signal will be given to the electrodes, which delivers the drug. So this is how it operates. So this is this diagram which shows that how it has been implanted in the rat. Okay, so next other drug devices, like we have got the microchip implant. So here the drug will be stored here. So which is covered with platinum or titanium membranes. Whenever this device is activated, this get melted and releases the drug. This is the microchip implant. These are the hydrogels and nanocarriers. There are many more devices which are integrated with the brain-computer interface. So what are the applications of these devices? Most of them are still in animal studies. The first one, we have got the pain management, on-demand analgesics. So the BCI, what it does, it detects the pain-related signals in real time, and it activates the drug delivery devices, the optogenetic channels or the microfluidic drug pump, and release the drug on time to the particular site. Okay, this is still in the animal model. It is mainly applicable for the treatment of chronic pain or post-operative pain. The second one is epilepsy, the seizure responsive anti-epileptic drug delivery. So here what it does, the BCI picks up the neuronal activity, that is the abnormal spike patterns in the brain that has been captured, that stimulates the drug delivery devices and release the drug on the particular site. So mainly used for the treatment of treatment resistant or the refractory seizures, focus, epilepsy. Okay, so we can use that. So one more, Parkinson disease. Yes, here what it does, the BCI detects the deficiency of dopamine. The signal will be transmitted to the device and releases the dopamine on demand. So that is the one we can distill in the animal model again. So we got depression guided antidepressant delivery. It can treat the treatment resistant depression by picking up the activities or the neuronal biomarkers with respect to the disease, then stimulate the device that releases the drug at site. So addiction and craving. So the drug induced craving, that signal will be picked up by our BCI system. Again, that stimulates the delivery devices that releases the drugs. So what are the advantages of this? Yes, personalized therapy. So because each individual requires the different doses of the drug. So it captures the activity which is happening in that particular individual and delivers the drug required for that person individual. So that is known as personalized therapy. So it minimizes the side effect by continuous dosing, because the traditional delivery drugs we give twice daily or thrice daily, okay, that will have a lot of side effects. Here, the dose required is in micro doses, okay, because the implant is so small, it contains the drug in very small quantities, and the drug required is in micro doses. So that minimizes the side effects and improves the adherence. Okay, the patient interference is not there, because in any other devices, the patient requires, he has to go and he has to take it and he has to switch it on. So many things are there. But here it is implanted and it is programmed. So everything is happening inside the brain. There is no patient interference here. So that is gives the high effectiveness of this delivery system. And it bypasses the blood-brain barrier. Obviously, we will be implanting the drug inside the brain. So there is no question of, it is difficult to cross the blood-brain barrier, all those things. So what are the challenges? Yes, it is invasive. We need to do a surgery to implant the devices in the brain. And the complexity, it is very difficult to capture all the signals, the brain signals, with respect to all the diseases like epilepsy or the depression. It is very difficult and it is very complex. And the safety and regulatory issues when we want to do these studies in pediatric patient or the neurodepressive individuals. And it is requires highly miniature and the biocompatible devices and extremely costly. And clinically it is not done, it's not there as of now. So mostly it is in the stage of animal models. Those are the challenges we need to overcome to bring it to the practice. So overall summary, we can use in case in future we develop the well-structured BCI assisted devices we can use for the treatment of all these medical conditions like epilepsy, pain management, Parkinson disease, and depression. So that's all about my topic. So thank you. These are my references. Thank you so much. Any questions? Any questions, you can just ask the references here. Okay? Because it's very difficult topics. I thank Nandini ma'am, Manjana sir, and the Department of Pharmacology for having me here. Thank you, sir. Sir, definitely we can think about that. Still, we can do that research, sir. That is a research idea. Anybody who is interested can take up that.
Because you mentioned about drug de-addiction.
Yeah, yeah, craving is there. Definitely, sir. If you can take it for all the possible diseases or anything, the only thing is you have to make an electrode that picks up the disease-related brain activity. That's all.
Okay, sir.
So I told you, sir, that is like invasiveness. So you have to do the implant first of all. You have to do the surgery in the implant because that can cause the infection. And over the period of time, what will happen is there will be rejection. Ah. Yeah, that is also one of that's why still in the animal models. So that is one problem, and the durability, how long this device works in the brain. So for that, they have come up with the explanation like something known as biobatteries. So biobatteries that utilize the body metabolism and they convert into electrical energy. So those are the things, but we don't know how once you implant that, how long this device is going to work and how frequently the patient has to come back to refill the drug or to recharge the devices. So those are the challenges still there. If these things are addressed, definitely, as sir said, we can extend to this method or the technology for the treatment of most of the diseases. What we need is to pick up the signals from the brain. Those electrodes are required. If those signals related to all the diseases can be picked up, though that can be translated to the devices that releases the drug. So that is also possible, sir. Drug craving or alcohol, de-addiction, whatever it is.
Just I want to add to
Yes, sir.
Dr. Navin's thing. The question what he was asking about chronic alcoholism. Okay, so definitely it can be done. But thing is, any person who takes the drugs along with this, there is always a possible, now what we are telling about drug-drug interaction, next in future will be drug system interaction, system failure, hacking of computers. There are all the challenges which you are supposed to face.
Drug device interaction.
Drug device. And just one point to add about the complication. The first person which I showed the photograph, who used just the mouse with his thoughts, the wires have been removed now. Because of some complication, the wire, they have removed the wire. So it is not possible to have that in a long run. So there is always a risk of that. Okay, so they have removed that, and now he is using it. So there are certain disadvantages, advantages, but only thing is, if it is applied for a specific purpose, definitely you can have. Otherwise, you can just imagine how the Robo 1, Robo 2 came. So the same thing can happen. That is the future. The threat is always there, and especially in the warfare, they can. So somebody who just thinks, and he just presses the button, automatically presses the button.
So no need to press the button. You just have to
Just think. As button press automatic. So the dangers are more. Actual threats are more than the advantage. Okay, so how much we are going to utilize this is the big question mark. Okay, just only for the unconscious patient to have a communication, or just to have the neurodegenerative condition. So how much utility? So that's what we told engineers, they have got the job to do. Okay, so they will do. But medical people, we are supposed to know how much to use, when to use. Okay, so we should not go with the acceptance.
A very nice presentation, sir.
Yeah, please tell me. I'm looking at you.
The thing is, I'm actually, by looking at that mouse video, we just got to know that it is on the brain, what they have tried on. So if it is happening with the human beings, the chances, I mean, it is the skull we are actually penetrating. Is it possible to go through that with the device what we have? When is it possible for all the, but it is all only for the neural networks, and is it possible to cross that thick bone structure?
Yes, these cochlear implants has been now doing it, right? So they can do that actually.
Deep brain stimulation is done, they pierce it, replace it.
Yeah.
But not like the animal, what you have seen, that is only for the experimentation purpose.
That's all.
Otherwise, the channel will be open there. They have to only connect it. Okay, so the instrument, whatever equipment, what is there, it is external. Okay, that will be connected when they go for example, for depression, when they go. There is just a socket there, socket type will be there. Just you have to go and place it, that will connect to the computer. But it is not permanently they are going to carry it. It is not a
No, this
permanent
is animal
device.
studies. It's very difficult to
Only for the
implant.
therapeutic
Yeah, that's all.
purpose.
So thank you, the entire Department of Pharmacology, for giving me an opportunity to come and present here. Thank you, ma'am. Thank you.
Thank you, sir, for that insightful presentation. The intersection of neural technology and pharmacology that you have highlighted truly gave us a glimpse of the future of medicine. I now request Dr. Nandini ma'am and Dr. Manjunath sir to present the mementos to our esteemed guest speaker. We will now be taking a short tea break. Please feel free to step out, enjoy some refreshments, and we'll continue the session at 11:15. Please assemble back. Thank you.
ಇದು ಬಿ ಸಿ ಐ ಸಿ ಎಮ್ ಇ ಅಂತ ಇದೆಯಲ್ಲ, ದಟ್ ಓಪನ್. ದಿಸ್ ಇಸ್ ಯು ಕಾಪಿ ಇಟ್. Yes, ಇದು you minimize karo. I will take that pen drive. Now madam will present. After that I will. And after that Sunil Kumar sir.
Sir, then man's PPT.
I think madam will give.
I checked it.
ಇದು ಕರೆಕ್ಟ್ ಆಗಿದೆಯಲ್ಲ? ಓಕೆ. ದಿಸ್ ಇಸ್ ಓಕೆ. ಅದರ್ವೈಸ್ ಹಲೋ ಇದು ಕರೆಕ್ಟ್ ಆಗಿದೆಯಲ್ಲ? ದಿಸ್ ಇಸ್ ಬೆಸ್ಟ್. ಇದು ಸ್ಲೈಡ್ ಚೇಂಜರ್ ವರ್ಕ್ ಆಗುತ್ತಲ್ಲ? ಹೋಗುತ್ತಾ? ಇಟ್ ವಿಲ್ ಚೆಕ್. ಹೋಗುತ್ತೆ ಬಿಡಿ. ಕ್ಲೋಸ್ ಇಟ್. ಆಯ್ತು ಸರ್, ನೀವು ಮಾಡ್ಕೊಬನ್ನಿ. ಹಾಂ ಸರ್. ಹಾಂ ಅಲ್ಲ, ಇದು ಇನ್ನೂ ಇದು ಕೊಟ್ಟಿಲ್ಲ ಸರ್, ಸ್ಲೈಡ್ ಶೋ ಕೊಟ್ಟಿರಲಿಲ್ಲ. ಹಾಂ ಇಲ್ಲ, ಈ ಸ್ಲೈಡ್ ಶೋ ಮಾಡಪ್ಪ. ಡೂ ಇಟ್ ಸ್ಲೈಡ್ ಶೋ. ಓ ಆ ಥರ ಸರ್. ಹಾಂ
ಬಟ್ ಏನು ಅಲೈನ್ಮೆಂಟ್ ಏನಿದೆಯಾ? ಏನಿಲ್ಲಲ್ಲ,
ಸ್ವಲ್ಪ ಅಲೈನ್ಮೆಂಟ್ ಇದೆ ಸರ್. ನೆಕ್ಸ್ಟ್ ಇದು ಮಾಡ್ಬಿಡೋಣ ಬಿಡಿ ಸರ್.
ಅಲ್ಲ ತೋರಿಸ್ತೀನಿ ಅಷ್ಟು. ಹೋಗಿ ಡಿಸೈನ್ ಇದೆಯಲ್ಲ, ಸ್ಲೈಡ್ ಸೈಜ್ ಇದೆಯಲ್ಲ.
ಹಾಂ ಸರ್.
ಸ್ಲೈಡ್ ಸೈಜ್ನ ವೈಟ್ ಸ್ಕ್ರೀನ್ ಅಂತ ಇದೆ ನೋಡ.
ಹಾಂ ಸರ್. ಓಕೆ.
ನಾಲ್ಕು ಇವಾಗ ನೋಡು, ಇರೋ ಒಂದು ನಿಮಿಷ ಚೆಕ್ ಮಾಡ್ತೀನಿ.
ಹಾಂ ಇರಲಿ ಬಿಡಿ ಸರ್, ಕರೆಕ್ಟ್. ಈಗ ಚೇಂಜ್ ಆಗಿಬಿಡಿ ಸರ್. ಇದೇ ಇರಲಿ.
ಅಲೈನ್ಮೆಂಟ್ ನೋಡ್ತಾ ಇದ್ದೀನಿ.
ಹಾಂ ಇಲ್ಲ, ಏನು ಚೇಂಜ್ ಆಗಿಲ್ಲ ಸರ್. ಕರೆಕ್ಟ್, ಏನು ಚೇಂಜ್ ಆಗಿಲ್ಲ ಸರ್.
ಆಯಿತಾ? ಇದು ಮಾಡಿದಾಗ ಏನಂತಂದರೆ
ಏನಪ್ಪ? ವಾಟ್? ನೋ ನಾಟ್ ಸ್ಕ್ರೀನ್.
ಏನಿಲ್ಲ
ಏನಿಲ್ಲಪ್ಪ, ಇದು ಪಿ ಪಿ ಟಿ ಅಷ್ಟೇ.
ನೋಡು.
ಹಾಂ ಎಸ್ ಸರ್. 16. ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ನೆಕ್ಸ್ಟ್ ಟೈಮಿಂದ
ಅಲ್ಲಿ ಇದು ಮಾಡಬೇಕು, ಪಿ ಪಿ ಟಿ ಮಾಡಬೇಕಾದ್ರೆ
3/4 ತೆಗೆದುಬಿಡು.
ಹಾಂ ಸರ್. 16.
ಯಾಕಂದರೆ ಇವಾಗ ಬರೋ ಸ್ಕ್ರೀನ್ಸ್ ಎಲ್ಲ ದೊಡ್ಡದಿರುತ್ತೆ.
ಓಕೆ ಸರ್.
जितना भी है सब
ಸೇವ್. ಮೇಡಮ್ ಪಿ ಪಿ ಟಿ ಇಸ್ಕೊಳ್ಳಿ
ಸರ್. ಇವಾಗ
ಮೇಡಮ್, ಆಮೇಲೆ ನಮ್ಮದು, ಆಮೇಲೆ ಪಾಟೀಲ್ ಸರ್.
ಸರ್, ಇದು ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ ಫೆಲಿಸಿಟೇಷನ್ ಅಂತ ನಿಮ್ಗೆಲ್ಲರಿಗೂ
ಮಾಡ್ತೀರಲ್ಲ. ನಿಮಗೆ ಈಗ
ಹಾಂ, ಯಾರ ಕೈಯಲ್ಲಿ ನಿಮಗೆ?
ನಮಗೆ ಇವರು ಯಾರು, ನವೀನ್ ಸರ್ ಕೊಡಲಿ, ಸ್ವಾಮಿ ಸರ್ ಕೊಡಿ.
ಅವ್ರಿಗೆ ಕೊಡ್ತೀವಾಯ್ತು.
ಅಲ್ಲಲ್ಲ
ಕೊಡೋದಿದೆ ಆಯ್ತು ಸರ್.
ಅಲ್ಲಲ್ಲ, ಅವ್ರಿಗೆ ನಮಗೆ ಕೊಡಬೇಕಾದ್ರೆ ಈಗ ನವೀನ್ ಸರ್ ಕಾಲ್ ಮಾಡಿ. ಹಾಂ, ಇಲ್ಲಾಂದರೆ ಬೇರೆ ಫ್ಯಾಕಲ್ಟೀಸ್ ಯಾರು ಇದ್ದರೆ, ಬೇರೆ ಫ್ಯಾಕಲ್ಟಿಯವರು ಎಚ್ ಒ ಡಿಸು ಅವ್ರು ಬಿಡಿ, ಅವ್ರು ಅವ್ರು ಬಿಟ್ಟರೆ ಬೇರೆ ಯಾರಿದ್ದಾರೆ ಫ್ಯಾಕಲ್ಟೀಸ್, ಬೇರೆ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಫ್ಯಾಕಲ್ಟಿ.
ಅವಾಗಿರಲ್ಲ ಸರ್, ಎಂಡಲ್ ಮಾಡ್ತೀವಿ.
ನೀವು ಎಂಡಲ್ ಮಾಡ್ತೀರ. ADD ಸರ್.
ನಂದಿನಿ ಮ್ಯಾಮ್ ಸರ್. ಅಜಯ್ ಇದಲ್ಲ ಸರ್.
ಹಾಂ,
ಪ್ರದೀಪ್ ಸರ್ದು.
ಅವಾಗ ಏನು ಮಾಡ್ತೀರಾ ಗೊತ್ತಾ? ಈಗ ಅನಾಟಮಿ ಯಾರಾದರೂ ಪ್ರೊಫೆಸರಿಂದ ಬಂದಿದ್ರೆ ನಮಗೆ ಕೊಡಿಸಿ.
ರಿಸೋರ್ಸ್ ಪರ್ಸನ್.
ಹಾಂ,
ಯಾರು ಅಂದರೆ ಲೈಕ್ ನಾವು ನಿಮಗೆ ಕೊಡ್ತಿರೋದು ಯಾರ ಕೈಯಲ್ಲಿ ಕೊಡಿಸ್ಬೇಕು?
ಹಾಂ. ಸ್ವಾಮಿ ಸರ್ ಇದ್ದಾರೆ. ನಾನು ಅದಕ್ಕೆ ಹೇಳಿದ್ದು ನವೀನ್ ಸರು. ಎಸ್ ಮೇಡಮ್, ಆ ಥರ ಕರೆಕ್ಟ್. ಎಸ್ ಮೇಡಮ್. ಬೇರೆ ಫ್ಯಾಕಲ್ಟೀಸ್ ಇದ್ದರೆ ಅಸೋಸಿಯೇಟಿವ್ ಪ್ರೊಫೆಸರ್ ಯು ಕಾಲ್. ಅದರ್ವೈಸ್ ನಮ್ಮಲ್ಲೇ ನವೀನ್ ಸರ್, ಸ್ವಾಮಿ ಸರ್ನಾಗ ಇದು ಮಾಡಿ ಮುಗಿಸ್ಬಿಡೋಣ. ಎಷ್ಟಿದೆ ಮೇಡಮ್ ನಿಮ್ದು? ಎಷ್ಟು ನಿಮಿಷ ಬೇಕು ಹೇಳಿ? ಹಾಂ ಬಿಡಿ, ನನಗೆ ಬೇಕಾಗುತ್ತೆ. ಸ್ವಲ್ಪ ನಿಧಾನವಾಗಿ ಹೇಳ್ತೀನಿ, ಬಿಕಾಸ್ ಐ ನೀಡ್ ಸಮ್ 30 minutes ಮಿನಿಮಮ್. ಬಿಕಾಸ್ ಹಾಂ ಎಸ್, ಬಿಕಾಸ್ ಇಲ್ಲಿ ಏನು ನೆಟ್ವರ್ಕ್ ಇಶ್ಯೂ ಇದೆಯಪ್ಪ. ನಾವು ಅವಲಿಂದ ಓಪನ್ ಮಾಡಿದೆ, ಅದು ಆಗ್ತಾನೇ ಇಲ್ಲ. ನೋ ದಟ್ ಟೈಮ್ ಇನಾಗ್ರೇಷನ್ ಅಲ್ಲ, ಬಂತು. ಹಾಂ, ಬಟ್ ಇಟ್ ಈಸ್ ಸಮ್ ನೆಟ್ವರ್ಕ್ ಇಶ್ಯೂಸ್ ಇನ್ ಮೊಬೈಲ್ ಜಿಯೋ ಇಯರ್. ಔಟ್ಸೈಡ್ ವಿಲ್ ಚೆಕ್ ಇಟ್.
It's working, sir. We check.
ವರ್ಕಿಂಗ್ ಅಲ್ಲ?
Yes, sir.
ಅದು ಅದು ಹೆಂಗೆ ಮಾಡಿದೆ? ಹಾಂ ಹಾಂ, ಮೊಮೆಂಟೋಗೆ ನಮ್ಮ ಇವರು ಗೆಸ್ಟ್ ಸ್ಪೀಕರ್ ಈಗ
इस चीज़ में
नेक्स्ट शुड बी यस यस माई सेल्फ अंड स्वामी सर और नवीन सर
एक दो
फॉर
तीन
सुनील ಸರ್ಗೆ ನಾನು ಮತ್ತೆ ಇವ್ರು ಕೊಟ್ಬಿಡ್ತೀವಿ.
इसको कहाँ कॉपी
ಸ್ವಾಮಿ
करना
ಸರ್
है?
ಬೇಡ ಬೇಡ ನವೀನ್ ಸರ್ ನೀವು ತಗೊಂಡು ಓಕೆ ನಮಗೆ ಇಲ್ಲಿರೋರ್ನೇ ತಗೊಂಡ್ಬಿಡಿ. ಬರ್ತಿದೆ ಇಷ್ಟೊಂದು ನೋಡ್ತಾ ಇದ್ದಾರೆ ನೋಡೋಣ. ಇದು ನೋಡಿ ಟೀ ಬ್ರೇಕ್ ಅಂತ ಬರ್ತಿದೆ ಬಟ್ ಇಟ್ ಈಸ್ ಇಲ್ಲಿ ಜಿಯೋ ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ನೀವು ರೆಡಿ ಇದ್ದೀರಾ? ಒಂದು ಓಕೆನಾ ಸರ್?
नहीं वो बोली वो मत रखो.
ಹಾಂ ಮೇಡಮ್ ಮಾಡಿಬಿಡಿ. ನೀವು ಯು ಕಾಲ್ ನೆಕ್ಸ್ಟ್ ನಂದಿನಿ ಮೇಡಮ್.
प्रूफ का नहीं आया, एक सेकंड रुको. प्रूफ का ये लो. ब्रेन स्टेट आया, मृदु का आया, अखिलेश आया, तनास का आया. चार ही है टोटल. तेरा न्यूरो एनाउंसमेंट आया, अखिलेश का आया, मृदु का आया, अपूर्व का आया. चार ही ना? ओके हो गया.
अभी नंदिनी मैम का पीडीएफ,
हाँ
मूर्ति सर का पीडीएफ, उसके बाद
सुन ना, लाइन में ही लगाते हैं उसको. देखना नंदिनी मैम, मूर्ति सर. हाँ लाइन में रख तो अच्छा है. ये अपने बंदों का इधर रख साइड में. और बड़ा कर लो उसको. इधर ही बैठ रहा है.
Welcome back, everyone. Proceeding with this session, up next we have our speaker, Dr. Nandini Ma'am, Professor and HOD of Pharmacology, Sri Siddhartha Medical College, Tumkur, with an MD in Pharmacology and multiple certificates in diabetology. She has over a decade of academic and research experience, including numerous published articles in reputed journals and presentations at conferences. She actively contributes to ethics committees, curriculum development, and CME programs. Dr. Nandini Ma'am has served in various academic roles from tutor to professor and head, and is also involved in extracurricular activities and university exam coordinations. She is multilingual and a member of Professional Medical Association. We welcome you, ma'am.
Good morning to good afternoon. uh, brain computer. Okay, so today's CME is about brain computer interface. Okay, so something kind of a AI technology which has been used here. So the artificial intelligence or this computer based things and all we were using it for the materials what we use, or we were getting okay, so we never involved human or the living tissue as such. Okay, so this is one thing kind of advancement, and this advancement is there in every field, every aspect, sports, culture, day-to-day activities or IT, anything, it's there. But in a health profession, it has played a really a greater role at some point, but will, is it really required? Or does it have something to think of? Is it really necessary on a long run? Or anything has to be thought on a longer run? Okay, so it's kind of a diplomatic thought what it leads to. So you'll just think into this. When they came up with a brain-computer interface, it was really a new topic, but all have got introduced to a newer thing. Okay, so when we read through this, there is something called neuroplasticity. Before getting into this, because the uses of BCI has already been told by Dr. Manjuna sir and also Dr. Pradeep sir. So same thing I'll be telling about it. But what my thought towards this BCI was, I think it should be used only when it is really required. Chronic cases, chronic diseases, but on day-to-day activities somewhere we should not get succumbed to machines. Okay, so humans should not become a machine. So we are so dependent on ChatGPT, we have stopped thinking. We just browse, we put words and like we get whatever we want, even writing the lyrics. So we have started losing our creativity and thought processing and everything. So it should not be done on a longer way. So there is something to think. So one of my close friend was telling like whoever sits and reads things, processes thought without touching the gadgets will be the top person in the near future. Okay, so many of them have become gadget freak. And these BCI related healthcare appliances are accessible to, now presently it is accessible to only high status people, those who are economically sound. It's not accessible to poor people. Okay, how our telephones were there, then it came to mobile, small mobiles, and then mobile is there in everyone's hand. Okay, similarly, this is in a smaller version, probably in 5 years, 8 years down the line, it may be accessible to everybody, but there is something to think of so that you don't lose yourself in this machinery world or in this AI tools. Okay. So here there are few uses which I just put it. Okay. So just like I was browsing through, I just saw this video where even talking to a person who conveys in a different language also has become so easy because of these AI tools. So no wonder we are getting into the brain, we are accessing people who are aphasic, not able to talk or not able to move. To help them medically with these gadgets it's very close by, okay? So because the innovations, the use of technology have geared up following COVID, okay? 2020 onwards, it's really taking up. I think 2025, again, it will gear up in a high speed, okay? So this video I just wanted to play. So it's become so easy. Before traveling, international tours were so difficult. Now it has become so handy, and everybody can travel. So word has become so accessible to everybody. So we should know where we play and where we stay and how we take ourselves.
Russian or any language?
Mani language. So do I get any discount if I buy? If I buy this one, any discount?
Okay, so looking into this, as long as it is at the level of gadgets or getting you using such gadgets, it's okay. But when it really gets into your emotional aspects or your thought process aspect, you should be really careful about it. So the uses what I have listed here, it is mainly related to neuro rehabilitation and neurological conditions where it has been used now. But it can also be misused in so many areas which has to be thought of. So here I'm focusing only on the healthcare systems where it has been commonly used. So it is used for motor restoration in case of muscle weakness. Yeah, as a communication aids, it's already touched. Okay, I'll just run through the slides. For seizure management, for early detection of electrical activity, and then early intervention for seizure control, cognitive rehabilitation, brain-machine interfaces for mobility, pain and mood modulation, sleep and attention disorder. So coming to motor restoration, the BCI in case of spinal cord injury, stroke rehabilitation, and prosthetic limb control. In spinal cord injury, BCI enables control of external devices by bypassing damaged spinal pathway, like robotic arms and wheelchairs. In stroke rehabilitation, the BCIs promote neuroplasticity using motor imagery and feedback training. The feedback training is just like we keep browsing through the internet, and if you see mobile to mobile, the person who browses, the same thing pops up. So your topic of interest keeps coming rather than. So if you check for person to person, it is a feedback loop, what sir said. It is a closed loop which operates. You train the machine, machine trains you. Okay, so such system has been used here in order to train the machine. So the machine in turn will help the person to train himself. Okay, so that can be corrected through the healthcare system. Okay, so basically here human is there, machine is there. So person cannot interpret, picks up the signal, machine converts it into, it decodes what he is thinking, and this decoded thing will be handled by the healthcare professional to help the deceased patient. So in case of prosthetic limb control, the BCI, thought-based control of robotic or myoelectric prosthetic limbs have been used. So in case of communication aids, there is locked-in syndrome called amyotropic lateral sclerosis. It allows text or speech generation through EEG-based BCI spelling systems. Okay, the patient can type or he thinks, the system types, and doctor recognizes. Okay. Severe motor disabilities, where facilitates the communication for patients who are unable to speak or write. In case of seizure management, especially epilepsy, BCI detects seizure activity and triggers neurostimulation or gives alerts. In cognitive rehabilitation, traumatic brain injuries, it aids recovery of attention, memory, and executive functions via neurofeedback mechanisms. In case of neurodegenerative diseases, Alzheimer's and Parkinson's disease, it helps to monitor cognitive decline and supports brain training exercises. Coming to brain-machine interface for mobility assistance, the BCI-controlled wheelchairs and also robotic exoskeletons. BCI-controlled wheelchairs, it enables movement through brain signal-directed navigation. Robotic exoskeletons, it translates brain commands into assisted standing or walking in case of paraplegics. For pain and mood modulation, in chronic pain management, BCI modulates neural circuits involved in pain perception. In case of depression and anxiety, it alters a brain wave activity in prefrontal cortex to improve mood regulation. Sleep and attention disorders, sleep monitoring, so BCI assesses and analyzes sleep cycles and disorders. In case of ADHD, it enhances attention and focus through EEG-based neurofeedback training. So future directions, to what extent it can evolve in future. So there can be closed loop BCIs, as Sir said, it is yet to work and get into implementation. For adaptive and personalized therapy, it's a real-time adaptation based on brain feedback. In case of epilepsy suppression, stroke recovery, and for mood regulation, it can be used. It's a real-time, it records, and then it can be modulated. In case of non-invasive BCIs, using advanced EEGs and NIRs for easier clinical deployment, it's a home-based neurotherapy, also bedside use and easier patient access. AI-enhanced BCI systems for more accurate decoding and feedback. The machine learning for decoding and feedback, it gives a higher accuracy, multimodal integration, and adaptive learning systems. So all these processes are in a fine-tuning process, so it is under this thing. So here it is a juggle between the machine and a human. So I don't know to what extent it will take. It should not be, as it poses a real ethical issues. There are good uses which has to be used. So of course the whole human should not be converted into a machine. So probably in another 5 years down the line, it can be an illusion, you can say, because person will be so individualized without any social interactions. So he may be mostly addicted to machine or something. So it's also think so that we think and genuinely use the gadgets, and also the healthcare system, the machines which are introduced in the healthcare system, thoughtfully used, and wherever it is accessible, so it has to be known and it should be made accessible, especially for muscle paralysis and also for aphasia patients who are really in need of this. So we can always use this BCIs. Okay. Thank you.
Thank you, ma'am, for that insightful and engaging presentation on the neuropharmacological implication. It was truly informative and thought-provoking, offering valuable perspectives for both clinical practice and ongoing research. We appreciate your time and expertise. Up next, we have Dr. Narasimhamurthy sir. Dr. Narasimhamurthy KM sir is an accomplished assistant professor of pharmacology, holding both MBBS and MD degrees, with significant expertise in medical education and clinical practice. His diverse professional background includes roles as a house surgeon, medical officer, junior resident, and postgraduate cum tutor, complemented by extensive participation in conferences and CME programs covering various pharmacological and medical topics. Dr. Murthy sir's expertise is further demonstrated by his dissertation on analgesic and anti-inflammatory activities, numerous oral and poster presentations, and 6 published research articles in reputable medical journals. We welcome you, sir, with a round of applause.
So good morning, one and all. Thank you for giving the opportunity to present this topic in this scientific session, that is CME. And thank you for the brief and sweet introduction from our students. Yes. So from morning, sir explained introduction about BCI, after that drug-assisted delivery, and madam explained in brief about pharmacological implications of this BCI, brain-computer interface. The first question is, who introduced the concept of BCI? Please, anyone, at least for curiosity, anyone Google it or know the answer, who introduced the concept of BCI first? So it is mainly by the Jacques Weidel. Okay, he is the person introduced the concept of brain-computer interface in the University of California, Los Angeles. How? By using the technology called, that is non-invasive method, EEG, electroencephalogram. You know who discovered this EEG? Ansberger, German, okay, a physician. He discovered this non-invasive method of recording the brain electrical activity similar to your electrocardiogram. Based on that, in the year 1920s, Ansberger introduced this EEG. After, in the 1940s or 70s, the person called Jacques Weidel introduced or termed the coin, yes, we can use this brain activity by recording the electrical activity of the brain, and we can control the computer by using some device that is called the signals emitting or transmitting from our brain. So that is called the basic background about this BCI technology. So there are so many uses, both for the restoration of motor, communication, speech, etc., and also for entertainment industry as well as for increasing the cognitive in some patients. It has some legal, ethical, social, as well as regulatory challenges we have to face. So this is outline of my presentation. That is the flow of this session. So, sir explained, without this definition, we could not understand anything. So there is a direct connection between our brain and external device to do something. It could be for what? Restoration, as well as for entertainment, and even case of military power surveillance. So what is this? It is a direct connection between the living neuronal tissues, that is our neurons, and using some artificial devices and establishes the connection. It could be non-muscular communication without any commands. Just you thought, based on your cognition property, we can take the appropriate action. So non-muscular communication pathway between a computer and a brain. So here, these devices responding to neural process in the brain that is called Neuralink. You already know that Elon Musk, in the year 2003, he has taken all these neural data by using invasive, non-invasive like EEG and functional near-infrared spectroscopy, MRI, all these. And based on that, he is able to implant some brain chips. So many failures. After that, sir explained, one is Stephen Hawking and another one person, they successfully implanted these brain chips for their communication restoration, for the restoration of motor communication as well as speech. So these are generates or modify the movements by responding to the neural process in our brain. So some of the crucial elements in BCI technology, these elements, with the help of BCI technology, it can able to identify directly the brain activity, provide feedback in real time or near time. So where there is a need, sir explained in case of neurocognitive feedback therapy for those who are suffering from psychiatric disorder, or to increase the cognitive enhancement in students. To maintain or increase the concentration, focus, these provide feedback in real time or approximately to near time, and classify the brain activity and provide feedback to the user, whether it's the patient or healthy individual, that reflects whether he or she attains the goal successfully or not. These are the crucial elements the BCI technology can directly detect. What are the applications? In brief, yes, it can be used as a spellers for individuals who have no other way of communications. At least you tell 2 to 3 conditions there, the person doesn't have any mode of communication from students. 2 or 3 conditions in which the person is unable to speak. Have you heard of Broca's area? Yes. What is the area number? Who classified these areas in the brain? Bradman area divided into 44 and 45. That is called Broca's area, located in the posterior inferior frontal gyrus. That is the main reason area in the brain which is responsible for language production, proper articulation, including grammar, fluency, etc. Where there is a lesion in that area, the person loses speech or communication. So you know, one is the condition called, Madam explained, Lacudin syndrome. It is nothing but type of a stroke where there is lesion in the ventral pons. There, the nerves supplying for the voluntary movements and speech are disrupted. That is nothing but Lacudin syndrome. And another one is called tetraplegia, other name is called quadriplegia. So nowadays, with increasing of this stroke incidence prevalence, this is helpful for restoration, where, sir explained, we can use this technology. If we use for specific areas, definitely it produces some benefit. Otherwise, it produces so many legal and ethical complications. So that's why stroke patients, quadriplegia or tetraplegia, please you remember any symptoms related to this stroke, we should not neglect. Because sometimes one beautiful statement is there, that is, uncommon manifestations of the common diseases are much more common than the common manifestations of uncommon diseases. You know the meaning of this? You take some time to recollect. Okay? So it is statement by neurologist called Dr. Raghavendra sir, our Dharmaraj sir friend. Okay, he's working as a professor and head at Father Muller. So he's a beautiful neurologist and okay, and clinical expertise. He explained everywhere. Please don't neglect any symptoms related to stroke. First you rule out a stroke. Next you go for other conditions because common conditions they present with uncommon manifestation. Just one or two or any weakness in the thumb or in the palm, it could be a stroke. Otherwise, this technology, we have to reach the BCI technology, all the things to restore the communication because it is a financial burden for the family members as well as the patient. So involving their lives by enabling them to regain some control over their environment. And paralyzed, I already told, don't neglect any symptoms related to stroke. So use their brain signals to control prosthetic limbs, cursors, and wheelchairs. So the main aim of this is restoring motor function, enabling communication, and some control over environment. So these are the main things why we are using this technology in paralyzed patient, either quadriplegia, tetraplegia, or Lacudin syndrome. Okay, I will go. So it is one of the rehabilitation aid in case of spinal cord injury. In case of diffuse axonal injuries, the person not able to move his hand totally like comatose patient and prognosis is very bad. In that condition, we have to restore and rehabilitate the patient by artificially stimulating the muscles. These are the important implications for this BCI technology. So that is disease condition. Other than this, we have to increase the cognitive in some cases like epilepsy, schizophrenia, schizoaffective disorders, resistant depression, and ADHD. And video gaming is one of the crucial game or important thing in entertainment industry. Some persons suffering with severe motor disabilities, they are unable to access this type of gaming. So it will helpful for give access to those persons to do this video gaming. So there is a recent development of that. Code modulated visual evoked potentials. Using these brain signals, we can control the video gaming, those with severe disabilities. And potential military surveillance applications, because it is helpful for collecting the data from the soldiers in difficult positions, and it is helpful for faster decision making, which should be accurate. Suppose some soldiers they're having stress and their cognitive level is declined, we can take that their cognitive, emotion, and decision capacity of the soldiers during the war, we can approach. Recently, the US Department of Defense has invested on this BCI technology. Okay. So here how enabling real-time monitoring of cognitive workload, decision making, we should be speed, faster and accurate, and even controlling weapon system with their thoughts. So after this, based on the investigation by so many researchers, we report that this technology, this research, brain-computer interface research, and its potential translation to therapeutic intervention, it generates significant social, ethical, legal, social, as well as regulatory challenges. These are some of the important challenges like human dignity, personhood, autonomy, cognitive liberty, mental integrity, social justice, fairness. Especially one important is informed consent, that is very important, and autonomy. So first we will discuss about some of the ethical issues related to this technology. Yes, first one, human dignity and personhood, privacy, safety, security, cognitive liberty and mental integrity, informed consent, and decisional capacity. So based on the analysis of user safety and benefit, we conclude that because there are two types of method called invasive and non-invasive methods. So in terms of safety, some authors assert that this technology may pose direct risk of harm of the users, especially the devices which require surgical interventions. It is a complex surgeries, involvement of neurosurgeons. They have to implant these silicon made brain chips, okay, into the, that is under the skull or inside the skull. So that is the first challenge, ethical challenge. For this, informed consent is required, and during the surgery, we have to explain in detail about what are the benefits, risk of this device, or that is technology. So potential complications, especially infection of the surrounding tissue, acute trauma to the brain. For long-term implants, it produces glial scarring, okay, which can surround the implant and impede, and it will disrupt the BCI technology. Non-invasive devices, I told you electroencephalogram and functional near-infrared spectroscopy. We are using this near-infrared spectroscopy. What is this problem? There, in this case, functional near-infrared spectroscopy, we can use the infrared rays. Based on their resolution, we can identify the oxygen level in the blood which supplies the brain. Okay, based on that, we can record the electrical activity using this functional near infrared spectroscopy. Okay. But some authors wonder whether the brain plasticity in still developing adults and children could bring about unknown negative side effects. Even they doesn't know the unknown negative side effects. Whether there is a unknown reversibility of this unknown negative side effect produced by all these devices. And next is, would the brain or the user return to normal after a BCI is removed? Okay. So would the brain or user return to normal after a BCI removal? Yes. You are approached and you have given for ALS, amyotrophic lateral sclerosis, involvement of both upper motor neuron and lower motor neuron. There obviously there is no proper motor communication, unable to speech, all the things. We have to restore all this. For how many years will you implant for those? Suppose any malfunction occurs, anything occurs, or for any uncertainty, you have to remove that implant from the patient. That is invasive method. After removing that, usually, okay, the normal person, okay, it will come to the normal, the brain, or it will be adjusted to that technology because it is controlled by device. That is the major ethical issues we face. So coming to the safety and security, especially is related to implanted ones, they pose risk of malfunction. At any time, the implant can stop its working. That time, who is responsible? if there is an infection and damage to the neural tissue that is called glial sclerosis. So hacking and external control of this brain-computer interface could lead to unintended consequences, including that called thought manipulation. They will extract all the thoughts, emotion from the person, but they can manipulate by altering the software. So he will tell something, but the person, he can manipulate their thoughts or control over physical actions. There is a misinterpretation of brain thoughts, okay, it may occur. So privacy, it is very important. See, these especially invasive ones can potentially reveal intimate details about an individual thoughts, emotion, intention. Okay, it will take all the neural data of the person. Okay, at any time, it could be manipulated. So it raises the privacy concern. How much the person or individual data can be protected. It should not be shared to anyone. So unauthorized access to neural data could lead to thought manipulation, that is nothing but brain jacking and exploitation. Based on that, they will misuse, that is called information theft. So these are the recent articles. Based on that, Article 18 Universal Declaration of Human Rights and Article 9 European Convention of Human Rights, according to these articles, so everyone has the right to freedom of thought, conscience, and religion. What it means, the important parts of our human mind are in principle out of reach of others, and no one can authorized to read off or writing into other brains. So we have to follow these articles there, how much privacy and safety security this technology produces. This is the ethical issue arises among all the researchers. Okay, because they clearly mentioned there is no, okay, unauthorized access. Without their consent, someone should not access all these neural data, that is called Neuralink. Cognitive liberty, yes, enhance or alter the cognitive abilities, raises the questions like cognitive liberty, freedom of thought, potential integrity, and manipulate or influence the mental state through it arises autonomy. Because it is one of the ethical principles in medicine field. You have to respect the patient values, okay, and their opinions. So how much this autonomy is protected in this technology. Social justice. So this silicon brain chip that is manufacturing, it will take $1,000 to $1 million for one chip. So this technology, it is not available for everyone. So another question is, there is no distributive justice, unequal distribution. Like this BSA technology could exacerbate existing inequalities by creating advantages for those who can afford. They will enhance their cognitive abilities, as well as they will restore motor communication as well as speech. But those who are not able to offer, then they won't get this benefit. That is the justice and fairness of this BSA technology. The availability of anti-cancer drugs and medicine is only costly, and who will afford this BSA technology in developing countries? Okay, only some people even in developed countries also, only few person can take this technology. They become user. Coming to the humanity and personhood. So direct interaction between the brain and machines. These interactions arise a series of questions regarding effect on humanity and personhood along several dimensions. So authors debate whether BSI become part of the user's body schema. Means they are adjusted. Without these, they can't do anything. So that is the one. And the question is it a tool or is it myself? That is the one ethical issue arises. So that's why the researcher said whether BSA users will become cyborgs. What is the meaning of cyborgs? Usually you know what are the capabilities of human mind and human being. But in these cyborgs, a person whose tolerances or capabilities are extended beyond normal human limitations by like a machine or other external agency. It is like a man-integrated machine system. Okay, integrated man-machine system. That is one of the important ethical issues that is called cyborgs. Same in locked in patient, it create hope for restoration of personhood. You know, what is the definition of personhood? So that is the state of being a person, individual identity. Whether it alters or disrupts the identity of a person, because the person feel like that, I am not doing anything, only my thoughts, okay, it will correct, it will transmit to these devices, and devices is controlling me. So that is, it may change my personhood, alteration. Does it causes any behavior abnormalities? Like that, one of the ethical issues arises. So finally, it will affect the fundamental human rights. Yes. How to take informed consent? Because sir explained the patient in comatose, all these things. For surgery and other procedure will take. But how to take the informed consent to protect the individual thought, emotions, okay, and privacy of these neural data. There is always ethical issues regarding this. So that's why ensuring that individuals have a clear understanding of the risk and benefits, able to provide informed consent is a crucial part for ethical implementation. So that's why we have to address this challenge, like establish robot process for informed consent, ensuring that individuals are fully informed about this technology risk, benefit, and consequences. Then only we have to allow them to participate in this technology. Coming to the legal concern, data privacy, protection, intellectual property, liability, and regulatory frameworks. Okay. See, collection, storage of neural data, again, privacy laws and regulations. That's why there is a clear legal frameworks needed to protect individuals' neural data and ensure responsible data handling. In that case, my thoughts are manipulated or accused some regulatory authority should be there to address their issues. Okay, no, we have given like this type of assurance, we can protect your neural data. Then it should be very good. So by this way, privacy and protect their personal data. Intellectual property, yes, significant intellectual property rights, including patents and copyrights. So legal frameworks need to protect these rights while also promoting innovation and accessibility. So suppose if this BCI device cause harm, who is responsible? Whether you file a case against manufacturer, insurance companies, regulators, or even the who discovered this technology, who is responsible? There is no straightforward answer for this question. So that's why there is a proper legal framework to address liability and responsibility issues, including sometimes if there is any malfunction or hacking and misuse. Some authority should take. So what is the drug regulatory authority in our India? Yes, answer. Correct. Sir. Student, sir. CDSCO. Correct. No, like for US FDA. For UK, Medicines and Health Products Regulatory Agency, that is called MHRA. So now, any drugs, cosmetics, okay, they will answer. For regarding these devices also comes under CDSCO, US FDA, MHRA. Does they have proper guidelines or framework to address regarding this BCI technology? That is the one more question. Okay. So this is the occurs in the some literature, because we are taken all the information from literature only, like sir said in the beginning. So some research participant who experience benefits choose to keep the device implanted for decades. Okay, anyway, the clinical trial related to this BCI, it lasts us for not more than few years. But some research participants, they are able to keep this implant for longer periods. That time, who is responsible for maintaining the implant in the long term and for supporting participants, especially they may not be able to get standard MRIs. When the person is implanted these brain chips, that is called including non-invasive methods, the person not able to take their MRI. You know what is the problem? Okay, that cases, who is responsible for those? Okay, obviously you should away from MRI and all, because these are the implants are the metals. So that it should be the responsibility of the participant, investigator,
insurance company, research funders, or medical device manufacturer. For this, there is no straightforward answer for all these issues, like your artificial intelligence. During robotic surgery, if something happens to the patient, who is responsible? Clinician, anesthetics, or that robotic that is used or trained by artificial intelligence method? They're also legal. Similar way, BCI technology, there is no straightforward answer for this. If some bad thing happens to the patient. So societal impacts like what if happens when such technology becomes widely available? How might it change our perception of normal human function? Madam said, so everything should not be become like machine and exacerbate existing inequalities. Someone you use it and they increases their cognitive abilities. Those who are not offered, they can't increase they are unable to increase their cognitive abilities. It is nothing but your intellectual property, memory, focus, concentration, attention, etc. So there are complex questions without clear answer, and they merit ongoing discussion as the technology develops. So that's why BCI device should be included in existing regulatory frameworks for medical device, what we said like US, FDA, CDSCO, all this. Suppose if there is a new regulatory framework is needed, there is also key legal question. What is the regulatory and how it will responsible to address these challenges? Cyber security, yes, protection of computer systems, data, etc. So these are devices are vulnerable to hacking and cyber security threats. For this also, some legal frameworks are needed to address this risk and ensure the security of the data and device. So this is also one of the important findings we have taken from the literature. These devices, the SR said, it is not able to, these devices are not able to fit in medicine. So despite the immense promise of these devices for drastically improving the life of those patients like amyotrophic lateral sclerosis, tetraplegia, Lacudin syndrome, all neurodegenerative disorders, the impact of the device direct linkage to the brain is not fully understood. Okay, so that's why the FDA's recent advice is called leapfrog guidance. Based on the changes of this technology, we have to alter and update the guidelines. According to that position, we also change to update and alter the guidance that is only they have given US FDA. There is no proper guidelines for this from US FDA because it is not fully understood. And see, issues with efficacy, reliability, and usability of brain-computer interface devices. From the year 2018, a study conducted by the American Academy of Neurology, they found that not in a clinical, in a home setting. So research for clinical setting with expert support, it is common for patient to lose interest in the device. Those who are using devices, after some certain year, month, they lost their interest to use or continuing the device. That is also one. And exact reason for losing their interest, don't know. And research showed that 14% of ALS patients using an EEG based, this is invasive method, based brain computer device at home lost their interest in the device over the period of 12 to 18 months of period. Okay. And devices are struggle to meet the expectations of patient using them. That is mainly it causes actual psychological harm of the patient because they feel that even we are using all this advanced technology, we are unable to meet the desired action. That is the one of the reason from them. That's why they lost their interest and they will escape or means they will away from this BCI technology. Another one serious concerns like responsibility to ensure medicine and medical device do not produce harm to vulnerable patient and need to support innovation because it is required for some patients. And we have to explain the harm produced by this device through managing the patient expectations of the device by educating the patients on the limitations of brain computer device technology. We can't give 100% assurance. There is no consequences. There is no complication, nothing. By proper communication between these and explaining all these consequences, we have to then, if they agree, we'll include in this technology. And one more, yes, the patient are using these devices at far away from the main cities and at home, there is no proper signal obtained by the device. It could be one of the reason for malfunction or error. That is called, it is reported by the Nigerian researchers. And usability, it includes based on the device aesthetics, and such as explained battery life regarding drug-assisted delivery system, and weight, as well as fatigue of the users. They will use every thoughts. Okay, sometimes the participants become fatigued from these devices. That is also produces potential concentration of the particular torque. Significant concentration, okay, causes are responsible of this. Usability is an issue. So addressing, so there is a proper ethical guidelines and legal protections is mandatory. It is not only the device manufacturer or research participant, no. There is a stakeholder collaboration is the key feature in this technology, like governments, international bodies, research institutions should work together to develop ethical, legal, and regulatory challenges to assess these issues. Promote transparency and accountability, prioritize user safety and well-being. Okay, all these. With this, I will conclude my session by addressing these ethical, legal, societal, as well as regulatory issues. We have to concern proactively. Society can ensure that this technology is developed and used responsibly. Where there is a 100% need, please you can go for that. Otherwise, you should not use for entertainment industry and some other to increase the cognitive enhancement, because so many drugs are available, so many other techniques are there to increase the cognitive enhancement. Okay, don't involve healthy individuals for this type of BCI technology. Benefiting individuals and society as a whole, and developers. This is very important, and policymakers must prioritize strong security measures regarding privacy protections and safeguard, that is neural data. Prevent unauthorized access to neural information, and a proactive approach is essential to ensure safe, equitable, and ethical development. And stakeholder collaboration is very key point, and it is a very crucial in this BCI technology. Government, international bodies, research participant, manufacturer, all these are, that is a collaboration is a must and should for this effectiveness of using BCI technology for those patients who are suffering from neurodegenerative disorders and other medical issues, unless it should be avoided. The best statement, the purpose of technology is not to confuse the brain, but to serve the body. Okay, so we should not confuse the body, our brain. So that is a well statement, because we don't know in the future, everything will depends on the machine means, then what is the role of our human brain? Okay, it is God created very beautiful machine, because it analyzes 1,00,000 times less energy uses than other what we have like computer. That's, please use your brain. Okay, thank you all. Yes, sir.
So regarding ethical issues, ethical issues about hacking from the system, or from your brain, okay, or from thoughts from your brain. I thought suppose hacking the thoughts means, where do you get your thoughts? Where does your thoughts? Suppose you are having 60,000 thoughts per day.
Yes, sir.
So where are they coming from?
Sir,
Are they really yours?
Sir, actually, based on that, it varies from individual, sir.
Yes,
because
it is different. Your thoughts are different from our
yes, sir.
Manjunath
That is
sir's
also one
thought.
challenge, sir. That is
So
one
where are
challenge.
they coming from?
So that is also one challenge, sir, because it is varies from not person to person. It is varies from time to time in one individual, sir. So morning the person has some mood. Immediately after 5 seconds, not only after 1 minute, he has some other thoughts.
So are they really yours? Because he is having one set of thoughts, he is having one set of thoughts. You are having different set of thoughts from morning, different. So are they really yours? If they are not yours, then how can you tell hijacking, hacking? They are not yours, I am telling.
See, it is not hijacking of a multiple thing. He has got a thought. That thought goes to the computer. It is stored in the computer. From the computer, anybody can act. It is not the thought which is going to be hacked here. From the computer, what are the information which is generated that can be hacked here. It's not from the, nobody can hack your, nobody can hack your thoughts. Thoughts cannot be hacked. Here, thoughts are not hacked. The person is not touched. Anything which happens, it happens at the system level, computer. It is at the only at the interface level, not at the human brain level.
No. I tell thoughts can be hacked. No. All your thoughts are stored in the Akashic records. Not only that. Wait. Not only in your pen it is stored. All your thoughts are in your pen, in your room. Everywhere it can be stored, you know. It can be hacked.
Okay, so I think we'll stop here. That is beyond consciousness. What you're talking is beyond consciousness. I think the audience are still in the subconscious level, unconscious level. You are above the conscious.
Thank you, Moti sir, for your enlightening presentation on the ethical and regulatory issues in BCI-bound therapies. Your discussion brought crucial perspectives to light, emphasizing the importance of responsible innovation and patient-centered frameworks in this rapidly evolving field. We truly appreciate your valuable contribution to today's session. Moving forward, we have our esteemed guest speaker, Dr. Sunil Kumar G. Patil, sir. Sir is a professor and HOD of psychiatry at Sri Siddhartha Institute of Medical Sciences, T. Begur, and a consultant psychiatrist at Spandana Healthcare, Bengaluru. With over 15 years of experience, he is a recognized PG and GUT teacher, authoring chapters in official books and publishing in national and international journals. He holds certifications in CBT and MET and is a trustee at Chitta's Anjivini Trust, providing free medicines for psychiatry patients. We are delightful to welcome you, sir.
Good afternoon to everybody, and thank you to the management of Siddhartha, Department of Pharmacology, Manjunath sir, Swami sir, and Narsimha Murthy sir for wonderful CME on this topic and inviting me for this topic. And it was really exciting for me to prepare the topic also. So to start with, AI looks very beautiful, nice, attractive, but how it is utilizing our own information to develop the industries, we are not aware of it. I don't know how many of you have read the book called as Sapiens by Harari. Anybody has heard about it? So he explains how the human evolution has happened and currently what is going on and what is happening to our brain in terms of not using many of the aspects of the brain, and slowly the areas are getting maybe attrition, and AI is taking over or the technology is taking over. I'll just give a small example. All of you are using YouTube, all of you are using Facebook, all of you are using WhatsApp. So now Facebook is buying YouTube, YouTube is buying Facebook, and WhatsApp is also getting included, and they're collaborating. What you do here, it will pop up there. With your permission, without your permission, it's something different, because they would have written in the down, if you don't do anything here, it will show there. So legally they are correct. So this information is getting integrated and utilized by the technology industries, and it is leading to some different consequences. Keeping aside this, the topic what was asked for your presentation is the BCI and psychiatry. So the BCI is mainly works when there is a computer, when there is a brain, and there is a collaboration. But in psychiatry, we have more of artificial intelligence, which is applied and utilized rather than the BCI, the machine itself. So in that aspect, I discussed and told that I would like to present about this artificial intelligence. So what exactly is going on in artificial intelligence in the field of psychiatry? Why this is being utilized is there is a around 10 to 14 crores patients are there in India alone, and the doctors' numbers, especially mental health related workers, are just around in lakhs. So you can relate the treatment gap, how much it is. So to fill that, maybe this AI is working and it is already implemented, especially in the field of EHRs, not exactly in the field of directly application, but it is slowly taking up. So EHR is more of electronic health records, and it works on the basis of data. Only that part is taking over, and it is really helpful. But really it is helpful in all other aspects, we can see in the further slides. So it helps in what all areas? It helps in, I think, a lot of discussion happened since morning. I'm sorry I was unable to come early, but they would have told about how early detection, how it is helpful in treatment, how it will be helpful in assessment, monitoring. They would have told in a lot of slides. Maybe the same aspect even in psychiatry it is helpful. There was one research which was done by one of the US scientists. He just wanted to see what is there going on in the mental health field, especially related to apps. When they went into search, they got more than around 5 to 10,000 apps being developed and being used in terms of emotional health or whatever. But when they really tried to follow it up, they kept on changing. As Narsimurthy sir was telling, it kept on changing. And some apps were deleted, some apps were not there, some apps kept on changing their technologies, rules, regulations, whatever. There was no one fixed apps which were working continuously on one guidelines. Only remained were around 600. So 5 to 10,000, in that 600 were little more genuine than others. So imagine people using this and believing it and working on it, where it will lead to. And as they have told, regulatory issues are always a problem. What is the limitation in psychiatry which can be utilized in AI is the clinical acumen and their differences. There are a lot of differences in diagnosis, their own approach to the patient, approach to the diagnosis. There may be limitations, especially in the field of psychiatry, because of the subjectivity. Lot of subjectivity is there in psychiatry compared to other fields. We have to depend upon the symptomatology, what patient is telling, what the attenders are telling, what we are collecting the details. On that basis, we conclude many details. So that subjectivity is a problem. AI can fill in the gap in this area. That's what they are thinking. So there are some examples I can give. Just now while coming, one of my psychologists whom I keep referring patient, she had sent a message that ChatGPT, woman files a divorce case after ChatGPT reveals husband's alleged affair through coffee cup reading, ending 12 years of marriage. This is a message I got. 12 years of marriage. So there are many intricacies in this, but just a detail what I'm getting, what is going on in the field where they are too much dependent upon some things which you really have to assess and go ahead. Another thing is, I am treating a boy who is around 22-year-old, and he goes to the same psychologist for treatment, and she keeps updating me about that patient. Updating is like, not before we used to tell how is he, what he is doing, like we used to interact like that. Now she sends a message. This is a ChatGPT discussion he had done and he has sent this. So I had to go through all the discussion. So in that he has written few questions. When I went through the details, I had relationship breakup with this girl, but somehow my psychologist was helping. I am in relationship with another girl, but I don't know where it will go. Nobody can help me. Neither psychologist can help me. Neither you can help me. So these were the wordings he has used. So immediately what GPT said is, kindly contact your psychologist for further assessment and evaluation. So it made notes out of it, and it gives a brief note, and that brief note to be sent to psychologist. The heading is also there. brief notes said to be sent immediately to psychologist. Means it got worried that he may end up in something else. So it don't know what to do. This is a real scenario what I am trying to tell. So this is another. And how it is helpful is suicide helpline and crisis interventions. Like many times we keep trying to train people for how to handle a person he approaches for any crisis, that he is not in a good condition, he needs to talk to somebody. Like we don't have human resources where they can really take up the call and attend it. Even the suicide helplines are there, they may not be available on that point of time, which is very crucial. So they have created some chatbots and conversational discussions on the AI so that initial discussion will happen and it will buy some time for the psychologist or the person to intervene later. It is helpful and it will give immediate support. That is really helpful because that crucial time is very important. So there are treatments in phobia. I am directly going into the treatment aspect because time is less and I have to cover many things. I cannot keep teaching what is phobia, how it will help. Phobia is where I can give an example is height phobia. Somebody has height phobia and we give treatment to them and we have to give exposure and exposure therapy. Where should I take him? Utility building, Bangalore, and train him, or take him to the highest building on 24th floor and train him. No, it's very difficult and it's not humanly possible. So AI developed screens have come where they'll show 3D pictures, screen will be there and they can put a boundary there. On that basis, the therapist will talk to the patient and he will experience it in a 3D picture. That is more helpful, more practical and usable. So in this it is helpful. And nowadays there are a lot of apps, no? Relaxation techniques, calming. There are so many things which are available in apps also. So in this advantage is the biofeedback is going to work. Like what is happening to his heart rate, what is happening to his pulse rate, what is happening to his breath rate. All these are given feedback and then it will control. It is more helpful. In EEG and ECG are being utilized and it's not that EEG, ECG machine should be big. Now it is coming in wearables also. So there is another thing which is called as gene scan. Anybody knows what is gene scan? Maybe somebody has covered something. It's available at present in Bangalore, where a pharma company has developed something to screen which medicine is sensitive, the person is sensitive, not sensitive, depending upon the various markers. So I don't know whether they have taken permission from the regulatories, but they are already using it and it is helpful also. So, sir? Maybe they have worked on so many things, but it is already used. So if I give a sample of the blood of that patient, he will give the details. I want to use a SSRI, one antidepressant among many categories to that patient. But I am not sure who is sensitive to something or what. Because at present it is based on trial and error. I'll start with escitalopram. If it is not helping you, I'll go to fluoxetine or I'll go to sertraline. But if you do this through the genomics or this gene scan, green, orange, red. Green will tell safe to use. Orange will tell with little risk. Red means don't use. It will give some idea how I can go about it, especially in elderly people and younger patients or medical comorbidities. So this is how it is helping. And again, self-diagnosis. Now many children are coming, 18 and 19, coming and sitting in front of me telling, I went through computer and ChatGPT is telling me I have ADHD. Please treat me. It's not here only, it's common in US, UK, now it is just spreading to India also. So there are some questions we can ask about, these are the things which are usually questioned. I think these questions would have come in the previous presentation or whatever, but we can come to this later if time permits. But there are many more questions attached to these things. And I think all of you know about these movies. Maybe some of you are already watching some other movies sitting behind. So there are sci-fi movies which are already based on artificial intelligence and also, as sir was telling, cyborg and the complete machine also, including Terminator, Transformers, Matrix and so many things. Matrix and Inception more of reality, virtuality combination. And Inception is more of a dream-oriented thing. So these are all things which are based on AI. And once you sit in front of those movies, until it finishes, you are gone. You are nowhere, neither you are hungry, you are not sleeping, complete the movie, because it is so gripping. It is so exciting, and it is because it is fascinating, it is not realistic in a way. That's why we like it. So there is one Hindi movie recently which has come. Shahid Kapoor is the hero. I don't remember the movie name. See. So nice movie which has been made on, like, they say that when humans, these robots are put with human emotions, they can lead normal life, faster life, all those things. But the end is always a tragedy. So what are the trends in mental health currently? There are something called EHR, which I mentioned, chatbot-based therapies, emotional health apps, smart mental health tools, and teleconsultation apps. At present, we are using only EHR, teleconsultation, and to some extent chatbot. That's it. Others are on the way for their development. I think this slide they have already covered. So these are the different apps which I am telling. So these apps will just conversational apps, they say, like ChatGPT is there, no? It's much more advanced AI. It's called a generative AI. As you discuss, it will go on discussing. It will remember everything, whatever discuss. Like that boy which I told, he told after third question, fourth question, as I discussed in the previous questions, do you remember I told this, I want to discuss on this. So he doesn't tell so he has to go back, take that information and discuss with him. And there are emotional health apps which are mainly for emotional well-being. It's not exactly for psychiatric disorders, it's just for emotional well-being. And smart mental health tools are properly data-based. Lot of data is put and they do psychotherapy. Psychotherapy is more of a intentionally creating rapport with the person to help him through emotional problems. So imagine how a machine can do it, but still it is helpful, but there are with lot of drawbacks. So it analyzes based on EEG, ECG, speech, blood test, and also social media and other things. Maybe I think in few slides they would have told how it is integrated. I think this slide also says the same, how diagnosis is done, detection is done, and how data is being utilized for treatment. So diagnosis, to some extent, as I told, imagine that somebody has a depression, and if there is some person who has depression, his thoughts will become slow, physical activity will become slow, his activity on the social media will become slow. So those are the things which are picked up by the smartphones or the apps what he is using, and it will show that possibly this person is into depression because these things are happening. It's not that exactly it will be perfectly all right. That's why wherever there is AI and BCI, there is something called human loop. Human has to be there to coordinate all this documentation. How it analyzes? It analyzes on the basis of his physiological changes, voice changes, and also behavior. Voice analysis is a much more advanced thing which is going on now, depending upon how the person is speaking, how many words he is producing, what is the intonation. On that basis it analyzes, including the facial expressions too. And also this is helpful in terms of video consultations, talking to people from far and helping them. That is a major help which is happening, especially in NIMANS. Telemedicine department is established and they are teaching psychiatric aspects through video consultation to many PHC doctors and also primary healthcare workers all over India. And through them they are trying to treat the patients who are coming to primary healthcare in terms of psychiatric issues. And many more details like therapies and all are not possible, but early diagnosis can be helpful. And as it has been told that data is the most important thing in terms of the proper therapy. Psychotherapy or what we call as cognitive behavioral therapy needs lot of data for especially AI related work. So that because therapy is very dynamic and it needs a lot of experience and also the previous learning experiences, especially previous past events also. So imagine a person is talking to somebody, it needs to collaborate so many details. So large amount of data is required, and that data again depends upon how they have fed the details, how it is integrating, how it is maintained. There are new models like I think somebody would have told about NLP. They would have told about LLM, large language models. These are things where they kept on loading lot of information, and if the information is enough to start a therapy for a perfect person, then they will work on it. There are some companies in US, they are already working on digital therapy also, digital psychotherapy. But red flags are always there where it should be used, not used. Any idea about what is digital phenotype? Anybody has heard about it? We know that there is a genotype where genetic code is there. We know about phenotype where there is expression of behavior. So how can we get this behavior if that person is not very open to any discussion or you're not giving any details? Or how to get information from him? There are a lot of apps which are being developed in US where they continuously it will monitor all the details, provided he gives a consent. They are doing on few research. Like a lot of research is always minimal number of patients, and it is you cannot apply it. And that's why this area is still a difficult area, and also research guidelines are also a problem. So digital phenotyping is mainly his digital footprints. What all he does in his smartphone, his computer, his wearables. Nowadays, everybody has smartwatch, everybody has smartphone, and everybody is linked to his computer, and also any other digital thing where he is signed in. All these things are documented and his behavior is checked. Example, if somebody is watching a YouTube mainly related to some diagnosis of some depression. So immediately Facebook also some device will come. How to diagnose depression through this device. You are not given any information, you are just searching it, but it will pick up that information. So those advertisements will start coming to you. And when you log out and come back to YouTube, it will again show depression related thing only. This is how digital phenotyping is done. And if that person has anxiety, if that person how many times he goes into anxiety related issues depending upon his heart rate, depending upon his sweating, depending upon his slowness or fastness, intonation, speech, everything will be documented digitally, and that is called as digital phenotype, and there are research going on this basis. But keeping behind the consent issues, privacy issues, everything is still there. But they are still working on this, and just getting your device and other things, you can decide like what type of personality he is, what type of anxious person he is, or any other related issues are there, you can get to some extent. So some research was done on this basis, some article I just took. Again, predictability. Again, on the basis of these devices only, the prediction can be done. Like somebody who is a manic. What happens in mania? Racing thoughts will be there, and they'll start action also. Physical activity is increased, sleep is decreased. Depression, I told no. Variables will tell your sleep analysis also. Sleeping less, not sleeping, inadequate, altered, everything will be recorded. So if this mania patient is there, his sleep is reduced. But when you go and ask him question, how is your sleep? I am fantastic, sir. Everything is fine. I sleep for 3 hours, but I am energetic like robot. But machine will tell you what exactly is the quality, what is happening within, and his physical activity is increased than what is usual. So the digital device is also helpful in terms of phenotyping is what exactly was like we call it as pre-morbid functioning. Before the onset of illness, what was the record and what exactly is happening over a period of time after the onset of problem. It will compare and give the details. Online app, sir. No legal and permitted, sir. But there are so many things you can utilize. We are not using anything. There is nothing. I'll come to that. So this is how it is prepared, and they are getting into this is how the research is going on at present. It's not that we have something and we are utilizing, but the research is going on in this model. And again, we can utilize it. You cannot directly tell, yes, this is, this sleep is less, physical activity is more, is mania. Nothing like that. We have to coordinate with clinical picture also. That's why humans are important in this. So this is how this personalized treatment outcome has also come on the basis of gene scan and others. So again, in the field of treatment, I think I have covered this also to some extent. So therapist. So I don't know how many of you know about the therapy and counseling. Anybody knows what is rapport? Students, they are having very good rapport with smartphones. But rapport with human beings is getting reduced. That's what I said, read the book called Sapiens, you will understand. how we are being hijacked by multinational companies for their industry. Whatever you see, no, even you look at one particular thing in YouTube and already the industries are behind you. How they are coming to know that what you are interested and how you are going interested. Today you are seeing what good shirt is there, but within 1 week somehow you would have bought that shirt. If the YouTube and other things are not there, you would have taken 1 month or you would not have bought that. So the technology is being utilized by hijacking our intelligences by the artificial intelligence. Anyway, you will learn it once you go through that. So how it is being utilized in the our field is, I told about phobia, and the similar thing, like we used to do motivational enhancement therapy for de-addiction for alcohol and nicotine. How to tell them motivation? When we tell them about motivation and craving management, we tell, imagine that you go near a bar, imagine that you have some opportunity to have bottle. How will you think about it? How will you avoid it? So we used to just talk to him. Now we have got something called virtual reality machines, where you can even create a bar, create a glass, create an environment where he can be pulled into that area, and we can tell him how we will want to handle this. How will you come out of this situation? He himself is a part of that virtual reality. It is more helpful compared to just talk therapy. In that angle, it is helpful. And also, it will start handling things, how any behavior related to addiction, it will start tracking, it will give the details also. Okay? So I think NLP I have discussed. NLP again for psychotherapy only. Depression patients and anxiety patients and these adjustment disorders, marital therapy, lot of psychotherapy is required, multiple sessions, time limited psychotherapy is there. For that, lot of work is going on, lot of data is getting collected, and some amount of work is already on for this, and some people are doing research also. So here what happens is they'll start therapy on the basis of that data only. If somebody is depressed, their thoughts, cognitions are altered. Cognitive restructuring will be done based on their cognitive distortions. Means, I am not doing well, so I am bad person, I cannot do this, my future is gone. So these are the things in his mind. So it will pick up those things, it will start giving alternative options to that person, and it will continue the discussion. So what I said about that boy ChatGPT, initially it was a very positive conversation, but once it went into loneliness and nobody can help me, that goes in favor of passive death wishes, or it may convert into active death wishes or suicidal thoughts. So it will just convert it into, please kindly consult your psychologist immediately. So those type of things are going on. I think this again therapy based I am telling, but drug delivery system I think sir would have covered. So follow-up also, like what happens in schizophrenia in psychiatry is the follow-up is the main problem. They won't take medicines properly, they don't do their routines properly because of lack of motivation or the cognitive issues, where this AI can be helpful to alert them, keep an update to them, alerting the mental health workers and alerting the family members. This coordination is very helpful, especially the wearable devices. Can you name some wearable devices which are in the market? So this is the one, which is Facebook also, it comes in a small this one. So this is what it is doing. I have not seen, and somebody we are discussing about this among psychiatrists. I told the rate of this thing is just 23,350 rupees only. So this is how it goes. So whoever is rich, whoever has iPhone, many things can be utilized in apps. But other smartphone, lower cost, it may not utilize more AI. So that is a drawback also. So this is a medicine related chart. So where all it is applicable, what they are doing is, because of the voice modulation, because of the facial expression, they are recording the autistic spectrum children where communication is a difficulty. So through the recordings of these children, they are feeding the information to the AI. AI is helping in communication through these children where they have a lot of issues in terms of communication, eye contact, language, all these difficulties are there. Seizures I will not cover, I think they told lot of things. Again, emotional AI is same, collecting the data and utilizing it. Emotional state is also found out through this. Emotional dysregulation. There is a condition called emotional dysregulation, especially we call it as EOPD, emotionally unstable personality issues or traits, where person will have lot of dysregulation in one day or month based. So there, these recordings will happen, and what exactly is going on in that person we can detect, and on that basis we can help, and also the AI can give clues. You are getting excited, you may go into dysregulation, kindly control your emotion, your heart rate is increasing, your pulse rate is increasing. Something like this, it will help. So those things are being developed nowadays. And the examples are all given to these people on the basis of therapeutic games also. And now new thing is Avatar is also coming, where therapy, it works as a therapist. Mood disorders, I told depression and mania, how it is being utilized. Schizophrenia, I have told. Schizophrenia, again, speech analysis is done. We have something called as formal thought disorder, where depending upon the speech sample, we can detect what problem they have. Going to help a lot, and big industry in the field of neuropsychiatry. And drawbacks, I think drawbacks are more than the advantages. I think it has been discussed in multiple things. I'll not add much about it, but one thing I can tell is, I don't know about machines, but humans are dangerous than machines, because you are loading the information in such a way thinking that it will be safe, and depending upon the government policies and regulatory bodies. And we have something called, one of the patient was telling, my brother is in US, he is a MBBS student. So I said, what he does? He is younger than me, but he is US. What is his job? Is ethical hacking. So if there is ethical hacking, which has been given importance, there is a learning, there is a training, and there is a job also, it is highly paid job. Imagine there are how many unethical hackers. So we should be worried about, not about ethical hacking, we should be worried about unethical hackers. And imagine if the ethical hacker is given 1 crore per year, unethical hacker can make 10 crore per year by just hacking. Both of them are hackers only. Who is more intelligent, who is not more intelligent, we don't know. But it is always a gray area, and we should be alert about it. Yes, sir. Advantages are there. I'm just trying to give a broader idea how it can be lead to, how safe it should be, how strong they should be. Because already we have seen that if there is something called Mental Health Care Act. Now the issue has come, I'll tell you. Mental Health Care Act says that you are dealing with human rights violation and all, you be more strict, we are strict with you, we are getting this app, we are getting this website, you have to enter all the patient details, you have to enter your registration, everything. So, okay, fine, we opposed it, but yet we implemented it. Patient comes and they have to give a phone number, his details are entered, message will go to him, then file is generated, then doctor details are entered, then he has to come to consultation. Patient will, Ramasamy will come and tell, I don't have phone. And another Lakshmama will come and tell, phone is with my husband. So these initial obstacles are there, where how to go about it, which is not given thought by the Indian government. They implemented it and they don't know how difficult it is, whether to consult him or not, whether to make file for him or not. Can we send him back, or we can do something? We don't know what to do. And any problem occurs, why you didn't do this, why you didn't do that. These are just small example which I can tell. So Mental Health Care Act 2017 is implemented. There is something called Advance Directive. Advance Directive is whether I can be given shock treatment or not. Today I can make a will and give it in a documentation into mental health website. That website. So if the doctor who is registered can go and enter and check the details. If that is not working, and we gave the ACT, and then it starts opening telling that it should not be given, what to do. And already damage has occurred if you don't give. If you give, it's a problem. If you don't give, I'm just telling simple things before going into the too many sophistication of AI. Another example is I went to a corporate hospital to see a patient. That patient told the treating physician is my friend, so kindly do not enter all the details into the computer. And without documentation, I cannot complete my assessment. So he said, if you want to enter only these details, don't enter this. Because he is my friend, he will also look into it. Hope you are getting how delicate, how sophisticated is mental health field, especially compared to the physical health. Because we have to deal with him, so we have to have that privacy, confidentiality, which is a prime components in the field of mental health. Patients will come only on that basis to us. Once that is breached, everything is gone. Either you do, the machine does, your reputation, your everything is spoiled. So this is a major issue, and there are many more issues which I can tell. Future trends is nothing but preparing ourselves. A doctor who has AI in his clinic or AI utilizing doctor is better than a person who doesn't use AI. In future, this will be the reality. You accept, you don't accept. AI is going to be there, whatever said and done. But how much you utilize, how long you are going to use it, and how better you can utilize is left to you. So this is one thing. Then testing and validations are the problems. So it's a 10,000 apps are there, only 600 are genuine. In that again, if you go strictly, again 300 will go down. So regulations are the biggest problems. Yes, answer please. Well, maybe 1 minute I have, somehow I come to this end. So AI can replace humans? Thank you. Accurate than humans? Yes or no is also not coming. Maybe you have to tell yes to your smartphone and ask her to loudly tell. So it is more accurate to some extent in some fields, in some areas. So there is no yes or no answers for these questions. That's why I have kept this. That's why I have kept. I am not for AI, I am not against AI. But it is useful. It is left to you. AI is dangerous to mankind. More yes, and more strong intonation is high, so I can get that. AI will take over control from humans. Yeah, Terminator, Transformers, they took over everything. Whole world is under danger. Superhuman has to come and protect. Anyway, we don't know about this, but why they are telling this is, if it learns the neural link, what sir has mentioned, and lot of neural networks are building, and they are trying to mimic the human intelligence exactly. So as the information goes into the neural network, how many of you have watched a movie called Third Eye, Hollywood? The supercomputer system is built and it will take over and it will start controlling all the people, whatever information is there, it will send information whoever is against it. You got my point? Imagine in a small scale. Imagine in a small scale in Siddhartha Institution, we have supercomputer which has got all the information and it can do anything. You start thinking double now only. So imagine how can it happen, supercomputers in multiple places, and supercomputer, it has got all the emotional information of all the people in Karnataka. Okay, I'm going too long. So what about consciousness? Dalai Lama was introduced to a robot and robot asked, hi, hello, how are you? So the Dalai Lama asked the robot, can you read my mind? Maybe, yeah, I can try, it will say. So reading mind is not as easy as how we are discussing here, how it has put up in literature. It's so difficult. The thought production itself is a complex phenomena in the brain, which we ourselves have not understood. There are discussions in mental health field among the psychiatrists that we ourselves have understood the brain or not is a question. So how can we depend upon AI to help the human brain and behavior? So how much we have understood? Have we understood 25%, 30%, 50%? So what we are going to enter into the AI? What it will understand, how it will interpret? So as Narsimurthy sir was telling, don't confuse with VCI. So already we are all confused. There are a lot of confusions going on in so many fields. So this might add on to more confusion if not done in a proper way, in a limited way, lawful way, ethical way, and utilize it to the best extent available with the human loop, not without the human loop is the message. And it does not have empathy, it does not have insight, it does not have a concept of right or wrong, it doesn't understand spirituality, it doesn't know what is philosophy, it doesn't know what is value system, it doesn't have any consciousness of develop, like how human has grown up from childhood to adolescent to knowing the relationship, people, love, affection, compassion. These things are lacking in AI. Imagine a person who knows everything but he is immune to all these things, what he can do. Okay, so with this I would like to end my presentation. I hope I have given a lot of important information for more thinking, more learning, rather than a gist of what is available. Lot of things are still not clear, but you should start thinking about it with always a pinch of salt. I can say thank you very much for the opportunity and thank you for kind listening. Yes, sir.
Humans are consciousness means conscious beings. AI is just a large language model. It just interprets whatever the information available, it puts here, there, that's all. So conscious beings, we can do much more than this. Only it interprets, matches here, there, that's all. But still it is useful for acute distress in patients like suicide prevention, all this you told, no?
AI is preventing you from talking, sir.
Yes, yes. Thank you.
Switching off in between.
Okay.
Any students, any questions? No need to stand and ask. You can sit and ask. So another aspect of AI is many people are more comfortable with Facebook, YouTube and chatbots than human beings because they are being judged. That's the advantage of chatbots where they'll start going and start asking questions. ChatGPT is going to become the best psychotherapist in next 1 or 2 years. Yes, sir.
Excuse me, sir. Thanks for good presentation, sir. I just had a doubt how this AI will help in diagnosis of psychiatric illness.
So
I was not able to understand that slide.
Sir, it is still in a development phase. What they are trying to do is if somebody is interacting, like a depression patient comes, his voice will be low, his body language, his intonation, his facial expressions, his physical activity, his sleep pattern, eating pattern, what does he do every day, going to work, not going to work, meeting friends, not meeting friends, how much he talks to people, everything is previously recorded. During this period in last 1 month, what he is doing, everything has come down. So it will go and tell that these are all things which are happening with this person. Possibly he has these things. Possibly. It will not tell 100%. But on these parameters, if like it does 100 people are like if the research goes on and 100 to 1,000 people are done on this basis and at least if it says 70% accurate, then they'll start utilizing it. Like we have something called PHQ, where health questionnaires are there and it will start telling this and this. If you answer, if it is yes, 8 out of 10, you are having this problem. ADHD criteria is there. A lot of AI-based question answers are there. If you are restless, you are agitated, if you are physically like this, if you are talking this much, you have ADHD. Lot of people are coming and asking that, and in US it has become a big headache now. Everybody has been assessed and lot of references are coming and they have to rule out and tell you don't have this, you have this, don't worry about this.
Okay. One more question, sir. Exposure to this screen time was there was some communication. The more screen time we have, the more chances of illness related to ophthalmology and mental illness.
Yes, sir.
Any diseases that are really said to be more prevalent in more mobile using and computer?
As a psychiatrist, I can tell that the mobile addiction itself is a major problem. That's why they are into the screen. So screen time has been increased, but the screen time again in that again lot of categories are there. Screen time, especially I don't know the high like Apple has got information that what time they are using in what percentage it will tell. And in Apple there is a I don't know how many of you know there is a blue ray light which can be adjusted in such a way that it is helpful to your eyes.
Yes.
Not all the phones have these things and not everybody knows about it. I
blue
go
filter.
to schools to tell about screen and social media addiction. There I keep telling about how this light can affect them. They think that 8 to 9 I will read and 9 to 10 I will utilize my social media. 9 to 10 if they see social media, they can't sleep for the next 12 o'clock to 1 o'clock. Because the light which has gone goes to the sends the information to melatonin, don't come now. I am still awake, like sunlight. So they won't get sleep even if they are on the bed. So it's a completely different topic which I can speak for 1 hour, sir. Screen media, social media and related issues.
Thank you, sir.
Good question, but big. Any questions from students? I am happy to answer. I don't have AI to approach me. You can ask any questions. So maybe if I had developed, there is an app actually, I thought I'll download it and send it to everybody. On that they are ready to ask. There is one app which they can scan it and take it. Ask questions, 100 questions will come. If I ask them to tell, so this is what we have to do. There is something called life skills. We have to develop these skills. Now it is coming down and somebody is very intelligent in this phone. But after that, like this. If we go on like this, imagine what is going to happen. That's what my thinking and my message to all of you.
I think what is more important here as far as ChatGPT is concerned, it gives only the text. The context is with the humans only.
Correct, sir.
So whatever the text it is giving, interpretation remains in the human beings only. You feed all the statistical data, again interpretation with the statistician only. So machine or a supplement, it cannot replace humans 100%. One of the example I just want to highlight technology, because one of the person, I think he's from America or India, he came as in the cycling this thing. He was explaining how the people are just hijacking the minds of the developing country. He told one simple example. They introduced the seedless fruits. In India, we had most of the fruits which had seeds. So these Westerners, they introduced these fruits which do not have seeds, seedless fruits. It was tasty. People started getting addicted to it. You can't grow it. Now you are dependent on America for the fruit.
Correct.
Now another example, Ambani. He introduced that geophone, free phones. If he made addicted, the whole nation is addicted to the mobile phone.
Then he stopped it. And
But
he
of
took
course,
something.
it has been utilized for plenty of UPI and all, it is utilized. But still,
Then
the
rates were
technology, you have to first standardize. As you told, initial stage, you have to first find out what is the risks, benefits, then gradually. But what is happening is, they want to get back the return on investment as quickly as possible, so they will spread it so wide. Marketing is so wide, within short time they will want to gain it and they have to forget about it.
So
Thank you.
as
Thanks
sir
for
told, last point I want to mention is, see, they are developing this psychotherapy, digital psychotherapy, where the computer says, hello mister, how are you, how do you feel? No, I'm sad, I'm not doing well. Oh, that's really sad, I think you are sad, what is going on with you? So what is the difference between a human talking like this and a AI is talking to it? There is a lack of compassion and comprehension. It just talks what is fed. If they talk like this, you talk like this. But there is no comprehension in that. There is no understanding, analyzing. The experiential thing, what the human has, it doesn't have. It will just compare the information and try to tell something. So it will never be able to connect to you in the angle like how humans are connected. That's why ChatGPT says, kindly go and meet your psychologist. So this is how it comes. Emotions, sir. But they are trying to feed that also, sir. That's why there is a problem. Facial expression. If you smile, it will also smile. You feel, oh, so nice. And as I said, the children nowadays, they are ready to type everything on phone and send you. But when you sit and talk to them, they'll be numb, they won't talk, they'll think that something is going to happen. So these are the problems we have to face. Now I am trying to teach life skills into a lot of schools and everywhere. They want me to please tell about social media addiction, please tell about screen time, please tell about how they can communicate. These things are coming up in the field. I hope this will never end. Maybe we have to. Thank you very much for the opportunity and thank you very much for kind listening.
Thank you so much, sir, for that insightful presentation on AI in mental health now and in future. You've given us a powerful glimpse into how technology is transforming mental health care, making it more accessible, personalized, and proactive. Your expertise and perspective are truly appreciated, sir, and I'm sure our audience has taken away valuable insights. Thank you once again for sharing your time and knowledge with us. I now request Dr. Swami, sir, and Dr. Naveen, sir, to present the memento to our esteemed guests. I now request Dr. Keshav Murthy, sir, Professor and HOD of Biochemistry, to present mementos to our resource persons. First, I would like to call Dr. Nandini ma'am. Dr. Manjunath, sir. Dr. Narasimha Murthy, sir. As you all know, we have organized workshops yesterday. So I would now call resource persons for workshop, Dr. Arun, sir. I also request Nandini ma'am to please present the mementos to resource person of workshops. Dr. Swami, sir. Thank you, ma'am. I once again extend my heartfelt gratitude to all the resource persons and our esteemed guests. On behalf of the organizing committee, we extend our gratitude towards resource person for your valuable time, insightful presentations, and engaging discussions during the conference. Your expertise and thoughtful contributions greatly enriched the sessions and provided meaningful perspectives for all the participants. Thank you for making this event a success. Now I request Dr. Nandini ma'am to present the memento to Naveen, sir. Thank you, everyone. We will now break for lunch and we will assemble back at 2 p.m. We have very interesting sessions lined up, that is Pharma Bites quiz and panel discussion. So we expect you all back in the hall at 2 p.m. Thank you.
Hello. Hello.
Hello.
Hello.
Once we'll check it there.
Hello. Hello. Audible. हाँ? Audible. Hello. Audio clear है? Audio clear है? Hello. Hello.
Good afternoon, everyone. I'm Anusha Chaubey and I'll be your MCs for this sessions of PGs and UG speaker. To begin this session, I would like to call Dr. Manoj. He's a third-year general medicine resident at Sri Siddhartha Medical College, Tumkur. With a strong foundation in clinical medicines and patient care, he has completed his MBBS from Government Sri Siddhartha Medical College, Vijayawada, Andhra Pradesh. His postgraduate training has honored his skill in clinical diagnosis, emergencies, and evidence-based treatment approach. Please, sir.
Good afternoon, everyone. I am Dr. N. Manoj Kumar, postgraduate in Department of General Medicine. Today, my topic is role of BCIs in tailoring CNS therapies. Brain-computer interface is an efficient brain-machine interface by converting central nervous system signals into commands for external devices. Alphanumeric grids, cursors, web browsing tools, special states, communication for individuals lacking functioning peripheral nervous system and muscular activity. BCIs are characterized based on invasiveness and signal processing in a synchronization. There are three types of BCIs according to invasiveness. One is completely invasive, partially invasive, and non-invasive. Further characterized as synchronous and asynchronous. Synchronous is versions initiating interaction which was prefixed, whereas asynchronous is BCIs rely on user-initiated tasks. BCIs provide an avenue for individuals without limb function to communicate, engage by controlling household devices and neural processes for mobility. There are four different main parts of BCI. One is signal acquisition, next is signal processing, giving commands, and fourth is application by BCI processes. The role of BCI in CVA, mainly it has effect on sensory rehabilitation, communication rehabilitation, assisted BCI where patient have complete disability, rehabilitative BCI where patient have partial disability. So it is mainly affects in neuro rehabilitation like sensory, cognition, motor and speech can be achieved by using brain-computer interface in cerebrovascular accident. You can see a patient here, probably left MCA impact with right upper limb palsy. Here how BCI is recognizing is motor activity in the right upper limb. It recognizes from signal from brain. As you know, it was placed over the scalp. Here, signals from brain are sent to computer, and it gives the moment you want it to achieve can be detected by computer. You can clearly see here now. Patient can move his upper limb. This role of BCI in neurodegenerative diseases like ALS, dementia, and Parkinson's. In dementia, they will have cognitive defects. In Parkinson, they have motor defects. In ALS, can have both upper motor plus lower motor palsy. I'll show you videos here also. Is a patient of Parkinson's with deep brain stimulation. You can see left side patient has deep brain stimulation on off. Patient has deep brain stimulation on. You can see how patient can walk on his own when there is deep brain stimulation on. This is one more case. This is synchronized movement. It is prefixed the amount of movement to be achieved. So this is before deep brain stimulation. This is after deep brain stimulation. You can see how fine-tuned movements are achieved by deep brain stimulation. This is a patient of ALS. You can see how she communicates by only her facial expressions. You can see how she is communicating to her partner. The role of BCI in neuro-oncological diseases. It addresses complications associated with brain tumor treatments, chemotherapy-induced long-term peripheral neuropathy, post-operative deficits in glioma patients. Role of BCI in epileptic seizure disorder. As we can see here, it has real-time EEG analysis, whereas in conventional EEG, where we record EEG during seizure-free interval, by having real-time analysis here, we can record full spectrum of disease by using BCIs. The role of BCI in spinal cord disease. It decodes brain signals indicating movement intention and translates them into motor stimulation. You can see here, patient of road traffic accident. Post, we had spinal cord injury, very loss of both lower limb muscle power. You can see at a time patient is giving multiple analysis to multiple muscles at a time. So you can have prefixed movement of hip, knee, and ankle. These are properties of brain-computer interface like invasiveness, adaptability, functionality, precision, and future potential. These should be mostly should be non-invasive because invasive have their own best benefit ratio and should be have adaptability like personalized adaptable solutions, demonstrated promisingly value for functional restoration, and should have high functionality, should have high accurate results along with future potential. These are present challenges which we are facing in BCIs like technical challenges, usability challenges, cost and affordability, safety and ethical, legal and social concerns. These are the future prospects like enhancing the augmentation into non-invasive BCIs, improving accessibility, cost and low research settings, improving technical challenges in reliability, and addressing privacy and safety concerns of patients. So from aiding communication ALS and locked-in syndromes, patients to enhance recovery in stroke, spinal cord disease cases, BCS have demonstrated significant clinical potential. There are certain issues that underline necessity for further research and innovation, particularly in enhancing non-invasive brain-computer interface techniques and integrating AI for improved signal interpretation and application. Any case we see? He has used BCI to share his ideas and thoughts to whole the world. Thank you.
Thank you, sir, for your insightful session. For our next session, I would like to call upon the stage Apur MG from second year MBBS, Sri Siddhartha Medical College, Tumkur.
Good morning, everybody. I am Apur MG, second year MBBS student from SSMC Tumkur. Brain state dependent pharmacodynamics refers to the principle that efficacy, potency, onset, and duration of a given drug are influenced by the current state of neural activity or brain function as measured by neurophysiological markers such as EEG patterns and functional connectivity maps. This concept integrates neurophysiology and pharmacology by positing that drugs may interact differently with neural tissues depending on the ongoing electrophysiological state. In addition, brain state dependent pharmacodynamics is explored in the realm of neurologic disorders such as epilepsy. Trials have investigated how anticonvulsant drugs modulate EEG responses to intermittent photic stimulation, directly linking drug action to the suppression of pathologic EEG patterns associated with photosensitive epilepsy. These studies demonstrate that pharmacodynamic responses can be effectively indexed by specific EEG markers. For instance, the reduction or abolition of paroxysmal EEG responses, thereby validating brain state dependent metrics as reliable indicators of drug efficacy and safety. The emerging technologies represent a new era of brain-computer interfaces that leverage multimodal closed-loop systems to integrate electrical, chemical, and even mechanical modalities for precise neuromodulation and monitoring. Each technology contributes uniquely to what BCIs can do. Adaptive deep brain stimulation represents a sophisticated evolution of traditional deep brain stimulation. In ADBS, local field potentials or EEG readouts are continuously monitored to detect pathological patterns associated with diseases like obsessive compulsive disorder. The system then dynamically adjusts stimulation parameters to restore functional balance and minimize the side effects. This approach epitomizes closed-loop neuromodulation, where the interface actively learns from ongoing neural activity and adapts its output accordingly, marking an important shift towards patient-specific therapy. The NeuroStack is a miniaturized wearable recording and stimulation platform that interfaces with implanted electrodes in humans. It captures high-resolution neural signals. NeuroStack systems can be used in advanced closed-loop settings that respond dynamically to neural events. This kind of real-time feedback is fundamental to the future of BCIs, as it promises personalized and adaptive therapies that adjust to the patient's neural activity. Wireless microfluidic drug delivery probes open new avenues for integrating chemical modulation with electrical monitoring. These devices incorporate built-in reservoirs and micropumps operating through various mechanisms such as electrophoretic, electrochemical, or thermal actuation to release drugs with high precision directly into targeted brain regions. Their wireless operation eliminates tethering constraints. When combined with neural recordings, such probes enable closed-loop interventions in which the drug release is not only precisely timed, but also tailored to detect neurochemical states. This multimodal capability pushes the boundaries of BCIs by integrating chemical and electrical therapeutic modalities. Electrochemical sensing probes further advance BCI systems by providing an additional layer of chemical specificity. These probes employ modified electrodes, often coated with enzymes like choline oxidase or protective polymers, to selectively detect neurotransmitters such as dopamine or choline. By integrating such sensing capabilities with electrical recording and stimulation, These devices make it possible for BCIs to monitor not only the electrical but also the biochemical states of the brain. The resulting feedback can drive on-demand adjustments in stimulation protocols to maintain neurotransmitter levels within desired range, thereby achieving greater therapeutic precision. BCI integrated spinal cord stimulators extend the BCI paradigm from the brain into the spinal cord, targeting motor dysfunction and enabling functional restoration, particularly in patients with spinal cord injury. By linking cortical recordings of motor intentions directly to spinal stimulation patterns, these devices can bypass damaged neural pathways, creating a bidirectional control loop. This technology has shown promise in restoring complex motor functions, such as grasping and walking, by leveraging a precise real-time decoding of neural signals to drive stimulation to the spinal cord. Collectively, these innovations demonstrate that the future of brain-computer interface lies in integrating multiple sensing and stimulation modalities into a coherent, adaptive, closed-loop framework. This convergence of electrical, chemical, and mechanical interventions is expected to not only enhance patient outcomes by delivering personalized therapy, but also expand the fundamental capabilities of BCIs in both clinical and research settings. Overall, the concept of brain state-dependent pharmacodynamics underlines that optimal therapeutic outcomes may require dose and timing adjustments that account for real-time neural activity. Clinical research is moving toward a paradigm of personalized medicine in which drug regimens are tailored not only to the patient's genetics and physiology, but also to their moment-to-moment brain state. Thank you.
Thank you, Apu, for your wonderful session. Now I would like to call Akhilesh Bitte from second year MBBS, Sri Siddhartha Medical College, Tumkur.
Good afternoon, everyone. It's an honor speaking on this CME for the Department of Pharmacology. Today, I will be discussing about brain-computer interface with a focus on their application in neurological and psychiatric disorders. BCI systems work by capturing brain signals, typically using EEG, electrocardiography, or implanted electrodes, decoding those signals and translating them into outputs like cursor movements, prosthetic control, or more relevant to us, that is therapeutic neuromodulation. BCI in neurological disorders, mainly epilepsy and Parkinson's disease. In epilepsy, one of the most successful clinical applications of BCI is in the drug-resistant epilepsy. The NeuroPace RNS system, approved by the FDA, in an implantable closed-loop BCI that detects abnormal electrical activities and delivers targeted electrical impulses to prevent a seizure before it happens. It's personalized and adaptive, learning the patient's brain patterns before overtime. Clinical trials have shown over 70% reduction in the seizure frequency after several years of use, with improvement in quality of life and cognition. In the case of Parkinson's disease, BCI have taken deep brain stimulation, that is DBS, to another level. Traditional DBS works continuously, but it doesn't adapt to a patient's changing brain state. With closed-loop DBS, brain activity is monitored in real time and stimulation is delivered only when pathological patterns, such as beta band oscillations, are detected. This approach reduces adverse effects and improves motor oscillations. In the case of stroke rehabilitation, in the realm of stroke recovery, BCIs are enabling motor returning by leveraging the brain's plasticity. EEG-based BCIs are used in conjunction with the robotic arms or virtual avatars to provide feedback with the patient's attempt to move a paralyzed limb. This feedback loop reinforces motor pathways and accelerates functional recovery. Meta-analysis have shown that BCI-based rehabilitation significantly improves motor outcomes compared to conventional physiotherapy, particularly when started early in the subacute phase of post-stroke. Psychiatric disorders, depression, OCD, and schizophrenia. Depression. One of the most groundbreaking applications were reported in Nature Medicine 2021, where the team of UCSF developed a precision guiding BCI for a treatment-resistant depression. The implant monitored brain activity associated with depressive states and delivered stimulation to the ventral striatum only when those patterns appeared. The patient reported rapid, sustained remission and incredible leap forward in personalized psychiatric treatment. In obsessive compulsive disorder, OCD, DBS targeting the nucleus accumbens or the subthalamic nucleus is being refined with BCI systems to deliver responsive stimulation, reducing compulsions and improving quality of life. These patients often have complex responses to pharmacotherapy, and BCIs offer a way to modulate circuity in real time. Schizophrenia. Experimental EEG-based BCIs train patients to regulate brain waves, showing early promise in improving working memory and executing functions, especially combined with antipsychotics like olazapine. Advances and trends in BCI technology. Non-invasive BCIs, combining EEG with near-infrared spectroscopy, enhances brain signal clarity without surgery. AI integration. Machine learning improves BCI precision, predicting symptoms and dynamically adjusting stimulations. Pharmacological surveys. There is increasing interest in combining BCI with pharmacological agents to enhance their effects. For instance, dopamine agonists can prime the brain for plasticity during the BCI-mediated stroke rehab, or antidepressants can stabilize effect, while BCI provides cognition training. Industry-driven innovations. Companies like Neuralink and Synchron develop minimally invasive, high bandwidth BCI targeting motor restoration, mood modulation, and addiction treatments. Ethical and clinical considerations. Despite this promise, several concerns remain. Long-term safety and durability of implants, the risk of device malfunctions or dependency, data privacy and ethical use of neural data, the need for regulatory frameworks that guide clinical use responsibly. These concerns emphasize the need for multidisciplinary involvement, neuroscientists, ethicists, clinicians, and yes, pharmacologists, to ensure safe and equitable use of BCI technologies. Integrating BCI into pharmacological treatment. Understanding brain chemistry. Pharmacologists expert in brain chemistry positions them to integrate BCI with drug therapies effectively. Complementary therapies. BCI complement rather than replace the drugs, enabling personalized adaptive treatment plans. Holistic care. Combining BCIs with pharmacology offers a holistic approach to neurological and psychiatric disorders. In conclusion, BCI represents a paradigm shift in how we understood and treat brain disorders. For neurological conditions like epilepsy, Parkinson's, and stroke, they offer real-time targeted interventions. For psychiatric illnesses, they provide personalized circuit-based modulations when conventional therapies fall short. As pharmacologists, we are uniquely positioned to understand how BCI-induced neural modulation can interact with pharmacodynamic and pharmacokinetic principles. The future lies not in replacing pharmacotherapy, but integrating BCI with personalized drug regimens to enhance efficacy and reduce the side effects. The frontier is wide open, and we're only beginning to explore its vast potential. Thank you.
Thank you, Akhilesh, for your informative session. Next, I would like to call Mradu from second year MBBS, Sri Siddhartha Medical College, Tumkur.
Good afternoon, everyone. It's a privilege to stand before you today and speak on a topic that lies at the intersection of neuroscience, biomedical engineering, and clinical care. A topic that is not just transforming technology, but redefining human capability and communication itself, BCI-assisted communication. At its core, a brain-computer interface is a direct communication pathway between the brain and an external device. When harnessed for communication, particularly in individuals with severe neuromuscular disorders, BCIs translate neuronal signals into commands. This means that thoughts alone, without any muscle movement, can now be used to operate devices and express intent. The evolution of BCIs, the concept of BCIs is not new. Early animal experiments in the 1970s laid the groundwork for what we see today. However, it is over the past decade that we witnessed a technological explosion driven by major advancements in neural decoding algorithms, artificial intelligence and machine learning, high resolution electrophysiological recording techniques, real-time signal processing. A groundbreaking milestone occurred in 2021 when researchers enabled a completely paralyzed patient to compose sentences using only their thoughts at an impressive speed of 18 words per minute. This was made possible using an intracortical BCI implanted in the motor cortex, which converted thought patterns into written text. Let us take a quick look at how this fascinating process works. BCI communication generally involves 4 steps. Signal acquisition, typically achieved through EEG, ECOG, or intracortical electrodes. Signal processing, raw neural data is filtered, amplified, and cleaned to isolate relevant signals. Translational algorithms, machine learning algorithms map brain signals to intended actions such as selecting letters or initiating commands. Output devices, the final interpreted signal is used to control a speech synthesizer, type text, or move a cursor, or even operate robotic limbs. Its application is in medicine, BCIs in prosthetics. For individuals with limb loss or spinal cord injury, BCIs are enabling control of advanced robotic prosthetics. Unlike traditional systems that rely on residual muscle activity, BCI-driven prosthetics interpret intent directly from the motor cortex. This allows more natural and intuitive movement. Some clinical trials have even shown success in integrating sensory feedback, allowing patients to feel with their prosthetic limbs and simulating areas of the sensory cortex. BCIs in neurological rehabilitation. In stroke rehabilitation, BCIs are used to facilitate neuroplasticity by detecting motor intent and linking it to virtual reality or robotic exoskeletons. Patients receive immediate feedback, reinforcing and retaining motor pathways. Similarly, in Parkinson's disease, closed-loop BCIs integrated with deep brain stimulation can adjust stimulation in real time, optimizing outcomes and minimizing side effects. BCI for communication in locked-in syndrome and ALS. Perhaps the most touching application is in patients with locked-in syndrome, ALS, or multiple sclerosis, conditions where cognitive awareness remains, but voluntary movement is lost. For these individuals, BCI spellers and speech synthesizers offer a lifeline, restoring their ability to communicate and significantly improving their quality of life. I have a video to show you how an ALS patient's life has been improved with the help of a BCI.
By using video recordings that were collected prior to him having the illness, we were able to digitally reconstruct his voice. So now when he tries to speak, not only do words become clear, but it feels a lot like me. It makes people cry who have not heard me in a while. I hope that we are at a time when everyone who is like me have the same opportunity as I do to have a device like this that will help them communicate by using.
More recently, semantic decoding models have shown potential to reconstruct intelligible sentences from cortical activity with up to 75% accuracy, bringing us closer to real-life thought and speech systems. The future of BCI emerging trends and innovations. As we look forward, several groundbreaking innovations promise to transform BCI-assisted communication even further. Like non-invasive advances, recent innovations in high-density EEG caps and optically pumped magnetometers are pushing the boundaries of non-invasive BCI systems. These developments aim to combine the precision of invasive methods with the safety and comfort of non-invasive tools, making BCI more practical for daily use and long-term deployment. AI and natural language processing. AI models, particularly transformer-based language models, are now being trained to predict and complete sentences from partial neural input. This integration of natural language processing dramatically speeds up the communication and reduces further fatigue, making interaction more fluid and human-like. Multimodal interfaces. Multimodal BCIs, which combine brain signals with eye tracking, facial EMG, or subtle muscle signals, offer enhanced reliability. These systems are particularly useful for individuals with residual motor function and can provide redundancy, improving system performance and user experience. Relevance to pharmacology. Now you might be wondering why this is relevant to us as pharmacologists. The connection is both direct and multifaceted. Drug BCI interactions. CNS acting drugs like benzodiazepines, dopaminergic agents, or anticholinergics can significantly alter the neural signals BCIs rely on. Understanding these interactions is key to optimizing BCI performance and ensuring safety. Neuropharmacological research. BCIs allow us to monitor brain activity in real time, offering novel tools for studying the pharmacodynamics of CNS agents in naturalistic settings. Targeted drug delivery. BCIs may be integrated with implantable drug systems, enabling brain-triggered medication release. For instance, detecting the onset of a seizure and autonomously delivering anticonvulsants, a powerful concept in personalized medicine. Ethical and practical considerations. With great power comes great responsibility. As BCI technologies evolve, so do their ethical implications. Privacy of thought. Neural data is profoundly personal. Who owns it, or how can it be protected? User autonomy. What if a system misinterprets intent? Should it override the user's control? Access and equity. Will BCI therapies be universally accessible or limited to the privileged few? Legal frameworks, informed consent protocols, and inclusive access policies must evolve in tandem with the technology. Societal implications and interdisciplinary collaboration. BCI systems also raise important legal, psychological, and cultural questions. Some may view them as invasive or unnatural, while others embrace them as liberating. Navigating these perceptions requires empathy and dialogue. This field is also a shining example of interdisciplinary science. Pharmacologists, neurologists, engineers, ethicists, and AI researchers must collaborate to co-create solutions that are not only effective, but responsible and equitable. Conclusion, restoring the human experience. Ultimately, BCI-assisted communication is not just about electronics or decoding algorithms. It is fundamentally about restoring the human experience. It gives voice to the voiceless, motion to the immobile, and dignity to the dependent. It reconnects individuals to their environment, their loved ones, and themselves. As pharmacologists, doctors, engineers, and clinicians, we each have a role in this unfolding narrative. Let us move forward with innovation, but also with integrity, ensuring that this transformative technology is safe, ethical, and accessible to all who need it. Thank you.
Thank you, Mradu, for your amazing session. At last, but not the least, I would like to call Tanaz Jimkhandi from second year MBBS to Siddhartha Medical College, Tumkur.
Good afternoon, everyone. I'll be speaking about neuroenhancement and cognitive pharmacology today. The pursuit of improved cognitive functioning is driven by the burden of disorders like Alzheimer's and depression, as well as rising interest in non-medical enhancement among healthy individuals. We'll explore how pharmacology, ethics, and technology intersect in this pursuit. Neuroenhancement, a broad concept it is, encompasses pharmacological, behavioral, and technological methods. It aims to improve attention, memory, learning, and overall cognition. It includes methods like pharmaceuticals, example, modafinil, stimulants, non-pharmaceuticals like sleep and exercise, and technological like TDCS and BCIs. Neuroenhancement isn't limited to pills. It's broad umbrella that includes various lifestyle and technological interventions designed to improve cognitive performances beyond the norm. Cognitive pharmacology. It uses drugs to enhance mental functions such as methylphenidate, modafinil, amphetamines, caffeine, herbal supplements, glucose, used clinically and off-label also. Cognitive pharmacology is the most studied aspect of neuroenhancement, particularly among students and professionals. However, it raises key questions about safety, fairness, and efficacy. Coming to nootropics, Nootropics are a heterogeneous group of drugs that affect the metabolism of neuronal cells in the central nervous systems. They mainly improve cognitive function, especially in cases where there is damage or degeneration. Most of these substances do not have an immediate effect after a single administration and must be used for some length of time before there is measurable improvement. They are used in acute, subacute, chronic conditions of memory, consciousness, and learning disorder, and as a supportive treatment in patients with Alzheimer's disease, schizophrenia, hyperkinetic disorders, or senile dementia. Nootropics are usually very well tolerated. Side effects are rare and typically mild, but some complications can occur. Its mechanism of action is as follows. Nootropics do not act directly by releasing neurotransmitter or as receptor ligands, but improve the brain's supply of glucose and oxygen. They have anti-hypoxic effects and protect brain tissue from neurotoxicity. They also positively affect neuronal protein and nucleic acid synthesis and stimulate phospholipid metabolism in neurohormonal membranes. Here we can see the three categories, the first being the receptor modulators. This category is made up of drugs which act as the rhymnobant and cannabidiol, which directly interact with receptors. The category 2 is enzyme modulators, which consists of drugs which interact with enzymes, usually in order to increase or decrease levels of associated neurotransmitter. Category 3, a neurogenesis promoter. This is a category containing all nootropics drugs which do not directly interact with receptors or enzymes and have been investigated for the treatment of major depressive disorders, MDD, amongst other cognitive effects. Cholinergic interventions. Cholinesterase inhibitors remain the gold standard for treating AD-related memory loss, although their benefits in healthy individuals are limited, emphasizing their state-dependent efficacy. Glutamatergic and serotonergic pathways. NMDA modulation and serotonergic agents. Ketamine is known for rapid antidepressant cognitive boost. Serotonin receptor targets 5-HT4, 5-HT6, 5-HT7, and neuroplasticity via mTOR and BDNF pathways. New insights show glutamate and serotonin play key roles in both mood and cognitive functions. Ketamine's fast-acting effects highlight the interplay between mood and cognition. Dopaminergic and noradrenergic strategies, stimulants in cognitive enhancement, agents such as modafinil, methylphenidate, and amphetamines. It gives benefits such as attention and alertness, but it also comes with risks such as dependency and dose sensitivity. These stimulants are widely used both medically and non-medically. Their effectiveness varies, and misuse or overuse can be harmful, necessitating personalized approaches. Classical and synthetic nootropics beyond pyracetam. Pyracetam is an AMPA modulation neuroprotection. Newer agents are aniracetam, Noopept, and sunifiram. Nootropics range from well-known substances like pyracetam to experimental compounds. Despite anecdotal support, most lack robust clinical validation in healthy individuals. Cognitive impairment in depression. Enhancing cognition in MDD. Adjuncts such as donepezil with antidepressants, modafinil for fatigue and focus. Depression often includes cognitive symptoms. Enhancers like modafinil may help, but it's hard to isolate whether the improvement is from mood elevation or true cognitive gains. Multimodal and neuroprotective approaches, targeting basically plasticity and combination therapies. BDNF modulation, example Noopept, combining RTMS, drugs, and cognitive training, and by personalized strategies emerging. Neuroprotective agents aim to modify brain structure and function long term. Combining modalities like brain simulation and pharmacology may amplify cognitive effects. Ethical and societal implication. As neuroenhancement grows, ethical questions emerge. How do we protect mental autonomy? Should enhancement be allowed for all? And how do we regulate access fairly? Neuro rights such as mental privacy, cognitive liberty, cosmetic neurology such as fairness and coercion, global disparities in regulation also arise. Usage trends and cultural insights. Who uses cognitive enhancers? There's highest prevalence of 10.4% in Germany, university prevalence, and risk factors such as stress, gender, early academic years. Surveys show increased use among students. Stress and competition drive this trend. Proactive education and lifestyle support can mitigate misuse. Emerging technologies, AI and brain tech integration, brain-computer interface and wearable EEGs, AI-driven real-time cognitive monitoring, ethical oversight lags behind innovation. New tech may soon allow real-time brain enhancement guided by AI. This could revolutionize therapy, but also raises significant ethical and legal questions. We can see a comparison here. Cognitive pharmacology and BCI, they are yet cognitive yet distinct fields. We see that in cognitive pharmacology, the method is biochemical, whereas in BCI, it's technological. Invasiveness is low in cognitive pharmacology, but it is low to high in BCIs with EEG to implants. Accessibility of cognitive pharmacology is high. Example, caffeine, easily available, whereas BCI, it is low, requires medical oversight. Goal of cognitive pharmacology is to enhance cognition, whereas of BCI is interface plus stimulation of cognition. Future directions. What's next for cognitive pharmacology? Longitudinal RCTs for safety and efficacy, integrated behavioral drug tech frameworks, biomarkers-based personalized therapies. The future lies in tailored evidence-based approaches combining pharmacology with lifestyle and tech tools. Long-term data is key for safety and societal trust. Conclusion, pharmacological tools show promise, but with limits. Ethical safety and regulatory gaps do remain. Holistic interdisciplinary research is essential. To responsibly harness cognitive enhancement, we must balance innovation with caution. An integrated, ethical, and scientifically rigorous path forward is crucial. Thank you all for your patient listening.
Thank you, Tanas, for your remarkable session. Now I would like to request Dr. Nandini ma'am and Dr. Manjunath sir to hand over the certificate and memento to our student speakers. I would like to invite Dr. Manoj sir to please come on stage and receive his certificate and memento. I would like to invite Apoor MG to come on stage and collect his certificate and memento. I would like to invite Akhilesh to come on stage and collect his certificate and memento. I would like to call Mradhu to come on stage and collect his certificate and memento. I would like to call Tanas to come on stage and collect his certificate and memento.
Moving forward, get ready for a dose of laughter and learning. The first year MBBS students are all set to bring pharmacology to life with a fun-filled creative skit that combines knowledge with entertainment. Join us for a light-hearted yet informative performance where pills talk, receptors react, and side effects steal the show. Whether you're a pharma enthusiast or just looking for a good laugh, this skit is the prescription you didn't know you needed. Medicine can be a lifesaver, but what happens when it causes unexpected harms through its side effects? As a coin has two sides, head or tail, similarly, medicine also has two phases, relief or risk. Our skit from the first year's batch, Zephyrs, highlights the crucial role of pharmacovigilance in identifying, reporting, understanding the pros and cons of various pharmaceutical drugs and expected adverse reactions and their preventions. Good afternoon, everyone. Here and we welcome you in the exploration of challenges and triumphs of ensuring drug safety in an ever evolving healthcare landscape.
Making you realize the enhanced beauty of life without the interference of that mischievous hypertension. Hypertension, and here we are to ensure your blood vessels are relaxed and open for conduction of smooth laminar blood flow. And here I am, Namaskara. I am amlodipine, the beat of a healthy heart, a calcium channel blocker. You can also recognize me as one of the intrinsic pathway that is cleaning your blood vessels or the plumber of your blood vessels.
Listen up, the sheriff's in the town. This bad boy walks in and blocks all those beta receptors and makes sure nothing happens to you. I am beta blocker, the great. Whether it's angina or high blood pressure or anything, I'm the one you come for. I'm the greatest. You need me. You all know that.
The OG pain punisher with a bark worse than your headache. A tiny tablet with don't mess with me energy. For sometimes your brain needs to chill and your head needs to stop drumming. Hi, I'm Aspirin, every medico's elixir after lectures.
Hi, I'm cannabinoids, the cool little compounds in cannabis that do all the heavy lifting, from chilling you out to easing your pain and even helping you sleep. Basically, I'm the behind the scenes MVP, making the plant more than just a vibe.
Good morning, victims of modern medicine. I am penicillin, the antibiotic that's been saving lives since decades. At least that's what I'm told. See, honestly speaking, I'm just a mole who likes to hang out and take out bacteria every now and then. And yeah, that's me. Remember the name, it's penicillin, since 1928. Thank you.
They say that the revenge is served best when it's cold, but I serve it in just 200 mg doses. A tiny tablet that's always there for you when you are in pain. I'm not magic, I'm ibuprofen.
The ultimate trauma slayer of the pain world. Whether it's joints, back, or the surprise irritating swelling, I'm there. Sometimes your body throws a tantrum. You need me. Even if you think you don't, you need me.
All right. All right, all the medical enthusiasts present here, hopefully you are well associated with me. Yes, it's me, the superhero of the CVS. working day and night to clean your blood vessels, protecting you from all the harmful wastes of your body. And then comes the villain, the hypertension, providing advantages to human heart by controlling your BP, selective L-type calcium channel blockage, and hence reducing the vascular resistance, treating hypertension, angina, stenosis, and other kind of activities. Huh. And the most favorite now comes, my plumbing action, maintaining the patency of the blood vessels. Ah, that's why I'm great.
Tachycardia, so tacky.
Oh my goodness, might be the civil war between the drugs has commenced.
Everyone knows I'm the greatest of all, the GOAT. You just give peripheral edema, dizziness, headache, and even increase the heart rate. Whereas I reduce the myocardial oxygen demand. I reduce the myocardial oxygen demand and even decrease the BP by decreasing the cardiac output. I'm just a great. You don't stand even a chance in front of me.
उल्टा चोर कोतवाल को डांटे हाँ You are the one who is creating the fatigue. You are the one who is creating dyspnea. You are the one who is creating weight gain. And now you are blaming me. According to the research papers that was done upon you, you are the one we are creating the patients to have a painful night. They can't sleep all night for you only. And bradycardia, and other than that, is the increasing chance of bronchospasm. Those are one of your great deeds. And you are the one you are coming to blame me. First take the blame yourself and then throw it upon me.
Oh, please. You're just a calcium channel blocker in a fancy designer packaging.
Saku.
Saku. Where do you come after post-MI?
Hypotension.
Arrhythmias?
Hypotension.
Tremors, anxiety, migraines, variety. Ever heard of it?
What about the Raynaud's phenomenon? Who are the one creating it, huh?
Designer packaging. That's it you are.
You, man.
Please stop. Let me talk about myself first. Trauma from the last night's study session. All-nighter, huh? Don't worry, I've got your back. Fever. Well, I'll turn down your internal thermostat without judging your poor life decisions. Headache. Why worry? When the mute button for your brain's drama is here, I'll also help you thin your blood so that your heart doesn't throw tantrums later. Anti-inflammatory powers, because I hate swelling more than you hate studying. I have been around forever. Basically the grandma of painkillers.
Fine, fine. Look, aspirant buddy, we need to talk. You're the OG painkiller. I'll give you that. You've been around since dinosaurs had backaches. But listen, let's pretend that you're not perfect. According to my research, you're a stomach menace. You slide in like I'll fix your headache and leave your muddy boots all over the stomach lining. Ulcers, heartburn, internal bleeding. You call that healing? Look at me. I help with pain. So you can go from ow to wow without making any groaning noises every time you stand up. You got anxiety? Chill in, my friend. I've got your back. Nausea relief? I'm the anti-buff your stomach didn't know it needed. And after your really dramatic day, I'm the one who shows you heaven.
Yes, cannabinoids. Let's talk about your side effects then. Your side effects are a great bag of weird. Okay, dry mouth, red eyes, memory loss, anxiety from the thing people take for anxiety. Pick a lane, bro. Your dosage rules are so vibe based. Start slow and go slow. What are you? Traffic sign? You turn every patient into a human science experiment, huh? One gummy, chilling, and the other, they spiritually left their body. And here we are, enjoying cartoons with their cats.
Let me tell you why I am basically the MVP of the entire medicine cabinet. Pain relief, I am your guy. Headache, backache, period cramps, I'm always there for you. Inflammation, I really eat that for breakfast. I am not just treating them, I'm evicting them. I am basically a multitasking champ. Fever handled, pain sorted, and I'm basically three medicines in a one trench coat. And yeah, I come in more matters than one. injections, chewables, tablets, etc., etc. I'm overqualified and over the counter for it. You don't need a prescription to hang around with me.
I would often say, I don't want to be mean, but seriously, man, you are a pain in the head of patients. You are a headache, both as a metaphor as well as in reality. See, you are a pain to the patients, that is, in more ways than one. Like, look at me. At least I'm saving lives, and I don't have a side of stomach ulcers at least. Ibuprofen, see, listen, man, you are just a quick fix, a temporary solution for those delusional patients who don't even believe in a permanent cure. I am the one who is going to the root of the problem and finishing it off once and for all. But see, you are just a placebo. I am the real deal. Not that I'm bragging about it, but without me, patients will be dying now and then. You had just be giving a headache to them.
Paracetamol, sorry, penicillin. Let me tell you, brother, you rock as antibiotics. Okay, but if someone is there with mild allergy, you ghost hard. Hives, swollen face, rashes. What do you not give? You roll in to destroy the bad bacteria and destroy the good ones as well. And the next day, the person is sitting in the bathroom thinking, was taking you even worth it? Nausea, diarrhea, yeast infections, you never really go quietly, do you? No, you have to make an exit performance. Your enemy is MRSA, penicillin resistant bacteria. They're trash talking you. See, we love you, penicillin. You walked so the other antibiotics could run. But maybe take a probiotic and humble yourself a bit.
I would often see. I meant to be quiet, but you made me speak again. You are low key just masking the symptoms, while I am here high key saving the lives of each and every patient with each and every dosage of mine. Period, man. Period.
Ah, so much. What to say? My aura is so much that all of you combined can bask in its glory. That too for generations. When your joints creak, that too louder than your grandma's rocking chair, I'm there. Whether it's post-eye surgery inflammation or pain, I won't negotiate. Just evict them. Like a boss. Abraham Band or kya hi bole. I just believe I'm the proof that heroes won't come always in cape. They sometimes come in blister capes.
Kindly refrain from speaking. You are hurting my ears. See, the thing is, if a patient comes to you with a simple, normal case of migraine, simple, normal case of migraine, you politely, please listen, you politely return them back with a complicated case of diarrhea.
But solution to the migraine, no?
Have you thought about your gastrointestinal side effects? Your stomach perforations, stomach ulcers, stomach bleeding.
That's just.
Hey, what about the cardiovascular risks? Please do listen. We have hypertension, we'll be having CAD, and along with that, the most important we are having, do you know? Stenosis, man.
Solution, no? You're forgetting.
What about renal impairment, potential kidney damage, or worsening existing kidney problems?
That just happens.
Forgot liver. You increase the liver enzymes and even potentially cause liver damage.
Miss Ma'am, did you forget the increased risk of bleeding due to platelet inhibition?
Ladies and gentlemen, they call me dangerous. Really? You're forgetting. What? The side effects. What? Stomach upset. How about living with arthritis without me? Those Monday mornings after a one-day trip. How will you survive? The real pain.
The end of our skit makes the beginning of a safer future. The curtains may be drawn on our skit, but the work of pharmacovigilance will continue each and every day. Pharmacovigilance is everyone's responsibility, from patients to healthcare professionals to pharmaceutical companies. So hence, let's prioritize and make it less risk and more of its benefits. Thank you.
That was a wonderful performance. post-lunch and some of you might be feeling a little sleepy, but don't you worry. This pharma quiz session is here to wake you up. I'm Muskan Fatima and I'll be your quiz master today. We've got 4 exciting rounds ahead, each one of us a little different and a lot of fun. So stay sharp and stay with us. It's going to be worth it. Where's the pharma quiz? Okay. Full screen. So we've already divided you all into 6 teams. So when I call out your names, call out your team number, please raise your hand. Let's do a quick roll call. Team 1, raise your hands. Team 1. Team 2. Okay, team 3. Team 4. Team 5. And team 6. Raise your hands, team 6. Okay. Okay, looks like we are set. Let's start with the quiz. Let me give you a quick idea about the rounds. So round 1 is the easy question round. General pharma-based questions. You'll be getting 15 seconds. And round 2 is the scrambled word. You'll be shown jumbled up pharma terms. Unscramble them in like 20 seconds. Round 3 is a picture round. We'll show you an image related to mechanism of action, drug classification, ADRs. You will get 60 seconds to answer. Round 4 is the hard question round. Challenging questions to test your deep knowledge. The time limit for this will be 20 seconds. This is not the one. Let me tell you the instructions. So there are 4 rounds, each with a time limit. If your team doesn't answer in time, the question passes to the next team. Scoring. No, there's no. The other PDF is not there. So as you can see on the screen, we've put the quiz instructions. I'll read it out for you once. For correct answer, for every correct answer a team answers, plus 10 points. For a first passed answer, correct answer, plus 7 points. Second passed correct answer, plus 5 points. For every wrong answer, you will have a negative marking of -5. The passing rules are, each question can be passed only twice. Say pass before the time runs out. If you answer wrong after a pass, you still lose 5 marks. Okay, so team 1, are you ready for to start the round 1? Okay. So I'm going to put up your question. You will be getting 15 seconds. You need to answer under 15 seconds, okay? Or else your question will be passed.
Option A, naloxone.
Okay, that's a correct answer. Team Team A wins plus 10. Team 2, are you guys ready? Your question's coming up. You have 5 seconds left. Do you want to pass it? You need to be fast. Okay, your question will be passed to team 3. Okay, that's a right answer. The third team wins plus 10 marks, and the team 2 remains 0. We'll be coming to the third question. That is again for team 3. Team 3, be ready.
Option A, sublingual. Option
That's
A,
a right
sublingual.
answer. Team 3 again wins plus 10 marks. Team 4, are you guys ready? For the for third question, sir. Option A. Oral, not sublingual. Okay, Yes, sir. Team 3 will be having another question, as third question is very controversial. So team 3, you're going to have one more question. Be ready for it. Are you guys ready? Okay, that's a right answer. Loop diuretics. Option B, loop diuretics. Okay, the next question is for team 4.
Sir.
Okay. Identify the drug which is not a prodrug. Ramipril, metoprolol, enalapril, clopidogrel.
It's option B, metoprolol.
Yeah, you're right. So team 4 wins 10 marks. This, which phase of pharmacokinetics involves the movement of drug from site of administration to bloodstream? Team 5, answer.
Option A, absorption.
Yeah, you're right. So team 5 wins 10 marks. Team 6, this is your question. Which of the following is not a potassium sparing diuretics?
A.
It's huh? Time done. You need to answer one. You're wrong. The option is A. The correct answer is A. And you're going to get -5. Answer is 4. Oh, team 4, the answer is actually D, and you get 10 marks. Team 6, sorry, team 6. Please, one person take the initiative and answer one. Please do not answer in groups. Okay, round two, it's the unscramble the pharma words. So you will be getting 20 seconds for each of them. So round one, team one, your question is on the screen and you get 20 seconds. You have 5 seconds left.
Penicillin.
You're right. I'm sorry. Just a minute. Is it wrong? I'm sorry. Huh? Okay, since you've got the hint, we will be giving you plus 5 marks. Okay, so team 2, you will be getting your question on the screen and 20 seconds.
Propranolol.
Yeah, you're right. Team 2 gets 10 marks. Team 3, are you ready for your question?
Paroxetine.
Yeah, your answer is right. Paroxetine. Team 4,
It's rifampin.
yeah, your answer is right.
I know.
Team 5,
Phenytoin. Phenytoin.
yeah, your answer is right. Team 6, yeah, you're right. So we'll be moving on to round 3, which is picture-based questions. Team 1, you're getting 60 seconds.
Third option, atropine.
Oh, you're right. Team 2, are you ready for your question?
Option D.
No,
C,
you're
C.
wrong.
Option C.
Okay, you get it. It's fine. So option C is the right answer. Team 3, your question is here. You're wrong. You're wrong. No, you're done. You're wrong. It's option A. It's very big. I already answered. already told the answer. Team 4.
Option D.
Okay, you're right. Team 4. Team 5. Okay, you're right. Team 6, your question is on the screen. Okay, that's a right answer. Atropine. Atropine. So we'll be going to the last round, round 4. Whatever answer. So for round 4, after round 4, I'll announce the answers. Final only, sir.
Group 1 has 30 points. Group 2 has 20 points. Group 3 has minus, okay, 22 points. Group 4 has 30 points. Group 5 has 30 points. Group 6 has 30 points.
I swear to God.
Very strict round. They not like what one answer we should give. That is a priority. Whatever you get first.
In round 4, we are going to be very strict about this, that only the first answer we hear, it's going to be the answer. So be careful, tell your group not to answer in group and individually answer it. Okay, we'll be starting with round 4. Team 1, you'll be getting 20 seconds.
Option A, cyclophosphamide.
Yeah, you're right. Group 2. Your 5 seconds are left. You're done. The next, Team C. It goes to Team 3. Option? Team 3, Team 3. Okay. Since Team 2 answered it, but they answered it after time, so we will not be considering it. It was time up. Everyone are telling. I'm sorry. So Team 3. Yeah, your answer is right. Team 3. Team 4 next. Team 4.
It's B.
Yeah, you're right. Team 5.
D.
You're wrong. It's a -5. Team 6, this is the last question. Okay, the 10th answer is D. Valpro. You guys still C. D. I heard it as C. You heard it as C, no? They said C, right? They tell. Okay, then team 5 will be getting 10 marks. Team 6.
Tetracycline. CCC.
Okay, that's the right answer. See, we have like a tie between group 1, group 4, group 5, and group 6. So there will be a tiebreaker question. Tiebreaker question. With the So team 1, you'll be getting only 10 seconds to answer because it's a tiebreaker question. So it's going to be. Your question is this.
It's not even visible. It's seriously not visible.
Okay, I'll change the question. What is the answer?
Option B, drug B is more potent.
Drug. Okay, you were right. Group. Which group has a tie? Which group has a tie? Four, right? No. I'm changing the question. Group 4, you will be getting 10 seconds, and this will be your question.
Induction of anesthesia.
4, 3,
C,
2,
C, option
1,
C.
-1.
C. C. Option C.
C. Yeah. It's a correct answer. Okay, the 5th group will be getting a question. Just a sec. Team 5, 10 seconds. 10, 9, 8,
Erythromycin.
6. Erythromycin. Okay, we'll be asking some new questions to all the 4 teams. Apoor will be doing that.
No options, yes, sir. No options, and I'll dictate the questions. Okay. Whoever has to wants to answer, just raise your hand and stand up. Raise your hand first, then stand up. No options. Yeah. So, team one, your first question. Which enzyme is inhibited by methotrexate? Done. Time up. Yes. Nobody knew the answer. No. Okay, okay, okay. So these questions are general. Anyone can answer. It's not only team one or team two like that. Anyone can answer. Anyone with the answer, stand up. Whoever stands up first, their team will be awarded points. And nope, no. There's no question of passes.
The answer to the previous question is uricase.
What? Dihydrofolate reductase. Okay. Next question. This is in general. Anyone can answer. Yeah. Name the only beta blocker that also has alpha blocking properties.
Answer is labetalol.
Correct. Okay, next question. Which anti-epileptic drug also treats trigeminal neuralgia?
Carbamazepine.
We got the answer there first. Correct. Carbamazepine is the answer. Team 5, right? Team 6. Next question. Which diuretic causes ototoxicity at high doses?
Furosemide.
Furosemide.
Team
Furosemide,
one.
I told first.
Furosemide.
It's team 4 also, 4.
Next question. Which anti-tubercular drug causes red-orange discoloration of bodily fluids?
Rifampicin, rifampicin.
Rifampicin, team 6. They raised before I completed the question.
Lakshana, raise your hand and then tell the answer.
Right.
Mic is not working. Team 4, team 4.
Just stand up if you want to. Don't wait for the mic.
Stand up and stand up. If she doesn't stand up, you
Wrong answer still has -5, so don't forget that. Which anti-cancer drug causes hemorrhagic cystitis?
Cyclophosphamide.
Team 1. Cyclophosphamide is the right answer. Next question. What is the drug of choice for status epilepticus? Wrong. -5. Team 6.
if you don't know the right answer, don't tell. Don't tell if you don't know the right
You're, it's over. Only one answer we're taking. -5. Team 6, -5. Diazepam is right.
Diazepam.
Yeah. Lorazepam. Hmm. Lorazepam. But you have to be specific. I asked drug of choice. Professors are saying no. Talk to them. -5. Yeah. Or okay, we'll give 0. No -5. No points, but for not being specific. What is the main mechanism of action of omeprazole?
TPI inhibitors. TPI inhibitors.
You have 3 seconds left.
Time's up. It's a proton pump inhibitor.
I'm sure.
I gave the answer already. Okay, next question. This will be the last question, so listen carefully. Which drug causes disulfiram-like reaction with alcohol? Team 1. Yeah. Team 1 has given the answer. Metronidazole. Yeah. Yes. Done. Okay, the tie is broken. My prediction is Team 1. Team 1 got 35 points in the tiebreaker, so 35 plus 40 is 75. Second is Team 6. They got 20 in tiebreaker round and 60 in total. 60 points in total. No third place. No, like, it is there. It's a tie between group 4 and 5. Third place. Yeah.
Listen, all of you. I'll ask one question. I'll see how many of you will answer. All of you, most of you are staying in the hostel. You know your hostel names also. What is Rajagruha? Why it is named Rajagruha? King's House. Sorry, wrong answer. Rajagruha. Hey, girls hostel, I know. Why it is named? See, all your hostels. What is the meaning? Who is Padmapani? Huh? What is who is Vajrapani? Oh, where you are staying, you find out why our honorable director has given the names of all these. All the names are related to Buddhism. Buddha. Rajagruha is not a ladies' hostel. Rajagruha name is given. It is a library of Dr. B.R. Ambedkar. So all the names, whatever is given for your hostel, they're all family members of Bhagavan Buddha. Okay, at least before leaving Siddhartha Medical College campus, you find out who are they, why they kept those names. All the names, all your hostel names, they are all family members of Buddha. Okay? Okay, thank you.
Team 1, please come forward, collect your gifts. Team 1, please come forward. Srisha, where is she going? Srisha, wait, we'll call them. Wait, I'll call them. Team 6, please come down.
Give them one more, no? Only 8 are there. दे दो दो
Winner team, stand for a picture. Team 1. क्या हुआ इसको? हाँ, team 5. Team 6 को बुला. Team 6, stand for a picture.
Good evening, everyone. It is my honor and privilege to deliver the vote of thanks on behalf of the organizing committee for today's insightful and intellectually stimulating CME session on brain-computer interface and pharmacological implications. First and foremost, I extend our heartfelt gratitude to our distinguished speakers and subject matter experts. Your presentations today have shed light on the fascinating intersection of neuroscience, technology, and pharmacology. The depth of knowledge shared, ranging from the latest advancements in BCI technology to its therapeutic and pharmacological relevance, was truly enlightening. A sincere thanks to our moderator and session chair for their excellent stewardship and for facilitating such a vibrant and engaging discussion. We are also deeply grateful to our guest speakers, faculty members, and students who have participated with such enthusiasm. Your active engagement and thought-provoking questions added immense value to today's session. Last but not the least, I thank the organizing committee and all the behind-the-scene volunteers, team members who have worked tirelessly to ensure the smooth execution of this CME. Let us carry forward the insights gained today and continue to explore the transformation potential of BCI and pharmacology in shaping the future of medicine. Thank you once again. Thank you all. Yes. All the organizing committee members, please come for a photo.
Committee members, come first.
Come here for a picture fast.
Already it is crowded, bro. We'll not even stand on.
We want one with us. Everybody in one photo. We don't want.
Not with these people. Aza Rishabh.
All the volunteers come down for the group photo.
नहीं खड़ा हाँ ये पापा का आ गया आना भाभी ये आ रही नहीं ब्रो बिल्कुल हाँ एक बात चढ़ जाओ लौड़ा आएगा फोटो में विजित मेरे को आना है थोड़ा इधर ऐसे अभी कमिंग आर्यन आर्यन हम लोग आ रहे हैं ना पापा को हमको भी आजा भाई हम बैठ जाए बोल रहे हैं तो बोल रहे पेड़ देना था बैठ जाओ CME बोले क्या बोले क्या अनिकेत शर्मा हम भी घुसे हैं सर्टिफिकेट एक ही की है क्या सर्टिफिकेट मिला था हाँ उसको
अरे बाहर है बोल रहे हैं बाहर है बोल रहे हैं
नहीं वहाँ पे उसका कैमरा में
हाँ ठीक है नीचे आए
थैंक यू सर थैंक यू
Volunteers stay back for the certificate.
we'll take care no
Sorry, sir.
So it's happening outside.
वो लोग बैठे हैं बाहर सर्टिफिकेट्स के लिए
बाहर ही है बट आई डोंट वांट हिम टू सी क्योंकि वो ऑब्जेक्शंस रेज करना शुरू कर
नहीं वो
दिए
अपने डेलीगेट सर्टिफिकेट के लिए बैठ रहे हैं अरे क्या हो गया था तुम वहाँ बैठे सबको कह रहे हैं मुस्कान मुस्कान
मैं कुछ काम कर रही थी and then I was like क्या हुआ then Apu started calling me I was like oh okay okay come
तुम ऐसे बैठे हमें लगा सो हो गई या तुम
वाइस
ऐसे
चेयर
सब मुस्कान
वाइस न्यू वाइस
I didn't hear only